committee. But really at the core of this national action plan is that we need to do three things, and we cannot do these alone. We need to be able to detect these products. So platforms that will enable all of us as stakeholders to know where they are. I'm really thrilled that we have the Border Management Agency with us and being a partner, because some of these are imported into the country. We need mechanisms collectively to say, how do we detect these? We then secondly need mechanisms that say, how are we going to respond? And then lastly, we then need to say, how are we going to prevent this? And these three core pillars of our national action plan requires that we have a multi-stakeholder approach, and I cannot stress this enough. And to be able to do that, we need to ensure that we've got proper governance and guidance practices in place of how we're going to cooperate. And secondly, how are we going to ensure that as we collaborate within South Africa, we cannot just focus on this country. We know that our borders are porous. For us as a regulator, we collaborate quite strongly within the SADC community, but also across the continent. And so I would like for you to also engage with your respective counterparts on the continent to say, how do we as a continent address these three pillars, which is detect, respond, and prevent. So the role of a global community, the role of the African community is quite important here. The second point I'd like to make is that good governance is going to ensure that we have sustainable mechanisms, mechanisms that are implementable. The team and the steering committee, they've put together a roadmap of what we will do over the coming years. But we cannot do it alone. We're going to have to say, how do we collaborate as a range of stakeholders, and how do we support each other? One of the elements that we're looking at within our Medicines Act, and we will be engaging with a range of stakeholders, is around how do we ensure that we can enforce some of these decisions that we would be making when someone breaches. And we need to hold each other accountable, because if we do not do so, we're basically saying our public can be exposed to these products. And I think that's not a message we want to send through. I would like to urge media to work with us here, to collaborate, because we need to access the public. We need to ensure that we get to those community radio stations. We need to be on all platforms that enables the public to know what it is that we're doing. And with that said, I'd like to thank all of you, and I look forward to the deliberations of the day. Thank you.
Tomorrow you are in something else. I don't want the laundry list. I want us to say, right, there's already a lot of work, as the CEO has mentioned, that has been done around almost isolating stuff that can make an impact. So taking advantage of all the brains in the room. In your table, first of all, there's going to be a table host, right? Dr. Fabrice over there, you are the table host over there. The CEO is going to be a table host here because she's the CEO. But in each of your tables, you'll confirm who's the whole table host. Because there's a person that I'm going to come to and say, what have you been discussing here? Right? Right. Now, the way we're going to do it to avoid the laundry list, there are three things we're going to do. How do we detect? How do we prevent? How do we respond? And you just say the one thing. That's all you're going to discuss. One thing. That we can do many things, but what is the one thing in your table that you agree must be done in order to prevent? What is the one thing that can be done more effectively to detect? And what should be our one thing response that will be very impactful? So it's a very simple assignment. I'm not asking you to do a lot of things before your lunch. It's not a free lunch. You are going to end that lunch by just giving. So on your table, you're going to give me 3 actions. Right? Now there are 20 tables here. So you can imagine already 20 times list already. So if you give me more than one thing in the table, you are now making the laundry list too long. We don't need that. Right? You just identify the one thing, because the other tables will also identify the one thing. So we'll have 20 things on prevention, 20 things on detection, 20 things on response. With 60 action items. I mean, I don't have to tell you that if you achieve half of that, you'll get an award. So that's what I'm pleading you. There's a lot of stuff to do, but just identify 3 things from your table. Okay? We're going to do that after the panel. Obviously, the panel will get into to provoke you into what are the things that work, that don't work, things that we should be doing, etc., etc. Right? So that the panel will also almost lead us into that. Back, and we report from each table, engage with that, and then that's how we're going to ensure that when we leave here, we have a solid program of action. We don't want the dialogue that's open-ended, that's just a mass meeting, etc. I don't want to refer to other dialogues as a mass meeting. No. We need something that is concrete quickly, not in a year. Right? When we leave here, we're saying, here's an action plan, but here are what the stakeholders are saying should be priority. Right? And then when we gather again in a year, and we now say, right, report on your one thing. And I want to put you exactly like this for those who are coming next year. To say, last year you said, this is the one thing that must happen. Now report back. What did you do as private sector? What did you do as government? What did you do as individuals who are in the health profession and so on, to make sure that this crisis can really be tackled? Okay? We are together. We are together? Wonderful. Is the minister ready, colleagues? Because at this point now, even I can run out of words now. I usually talk, to save my life. Talk to myself for 15 minutes,
I believe that the Honorable Minister is ready. They're just waiting for him to say a word or two. So
Minister, we are ready if you are ready.
Ready, Prof. Can I start?
You can start, Minister. Welcome. It's over to you.
Thank you very much, Facilitator Professor Tawani, the World Health Organization Country Director, Ms. Shinas El Halabi, the SAPRA CEO, Dr. Buitumelo Semete Bukogotela, representatives from the Medicines Agency, representatives from other continental and international agencies, the multi-sectoral committee that developed the South African National Action Plan. ITISMA could not be physically be with in collaboration with the World Health Organization, led by SAPRA, are conducting a pilot on the National Action Plan on fighting substandard and falsified medical products, a member state mechanism which its success will inform rolling out the National Action Plan, a handbook to the UN member states. This has been a year-long journey, and I'm delighted to officially launch this development action plan today. The purpose of the launch is to officially present the party's substandard and falsified medical products and to mark the end of the Republic of South Africa WHO pilot on the draft handbook on combating substandard and falsified medical products. Through these bold initiatives, South Africa is positioned among the first countries globally to operationalize a comprehensive strategy against substandard and falsified medical products. The National Action Plan aims to strengthen prevention, detection, and response mechanism through a coordinated multi-sectoral action as guided by the National Action Plan draft handbook developed for the purpose by the WHO. This milestone demonstrates South Africa's leadership and effective medical products. The event also serves as a platform to mobilize political, technical, and financial support for implementation, while raising public and media awareness about the dangers posed by the substandard and falsified medical products. The World Health Organization handbook mentioned the importance of political commitment, resources, and sustained coordinated action to combat medical product, falsified medical product, and restore and maintain trust in the health system. This will affirm South Africa's leadership and political commitment to this critical public health issue. The World Health Organization defined falsified medical products as medical products that deliberately or fraudulently misrepresent their identity, composition, or source, and this has not even been authorized by the regulator to be in the market. Substandard medical products are authorized medical products that fail to meet the quality standards or specifications, or both. This can occur due to poor manufacturing practice, inadequate quality control, or other unintended errors during production. These products may not work as intended and can pose significant risk to patient health. Substandard and falsified medical products are a threat to individual lives and integrity of health systems globally. As we launch the National Action Plan against falsified and substandard medical products, we reaffirm our commitment as the department to ensuring that every medicine, every vaccine, and every health product available to our people is safe, effective, and is to a highest degree of quality. A significant percentage of substandard and falsified products circulating globally are found in Africa, and this presents a serious concern for public health, affecting attainment of Sustainable Development Goals, SDG 3, which aims to ensure universal health access to all. A common finding from the World Health Organization Global Benchmarking Tool Assessment in various countries is the need to strengthen the market surveillance and control function, which files the SMPM. The World Health Organization draft handbook frames the strategic objectives and goals with actions, inputs, outputs, and outcomes used for developing strategies and operational plans, and provide insights into approaches for operational planning monitoring and evaluation. The developed National Action Plan provides a framework for addressing the threat of SF medical products and supports strengthened technical capacity and stakeholder collaboration across all parties engaged in the manufacture, importation, distribution, and supply of medical products. All actors within the supply chain, particularly at key pinch points in both the public and private sectors, must be equipped with the knowledge, the skills, and equipment to identify and report suspicious products to SAPRA. All activities should mitigate the risk of substandard and falsified medical products. This includes increased vigilance at ports of entry, through to post-market surveillance of high-risk products, inspection of manufacturers, distributors, and wholesalers. The fifth ordinary session of the African Union Specialized Technical Committee on Health, Population, Nutrition and Drug Control, held in Addis Ababa, Ethiopia, on the 5th to the 9th of August 2024. That is the expert session and ministerial session, expressed the deeply concerning concern regarding the proliferation of substandard and falsified medical products on the continent, which poses a real threat to public health and economy loss in Africa. The number of substandard and falsified medical products incidents from Africa reported through the WHO Global Surveillance Monitoring System have been increasing over the years. In October 2022, several deaths of children registered in the Gambia were linked to substandard medical products. WHO in 2012 established a member state mechanism on substandard and falsified medical products, the global forum at which member states convene, coordinate, decide, and organize activities to address substandard and falsified medical products. South Africa chairs the governance working group of the MSM, also known as leveraging the competencies of relevant stakeholders, including policy makers, procurers, distributors, practitioners, patients, and consumers, and good governance to reduce the burden of substandard and falsified medical products. I therefore recommend the joint effort of South Africa led by Health, via SAPRA, and WHO for conducting a pilot study to implement the WHO draft handbook on developing the National Action Plan for combating substandard and falsified products. The National Action Plan was developed through a multi-sectoral process involving government, regulators, enforcement agencies, academia, industry, patient and advocacy representatives. The process was informed by the pilot implementation of the World Health Organization draft handbook for the National Action Plan on substandard and falsified medical products. The pilot tested practical arrangements to prevent, detect, and respond to SF products across the supply hubs. Insights from the pilot informed the refinement of the National Action Plan, ensuring that it is context-specific and operationally feasible. A multi-sectoral steering committee was established with secretariat and technical working groups drawn from government departments, regulators, enforcement agencies, academia, and industry. This inclusive and evidence-based process ensured that National Action Plan reflects national priorities, aligns with WHO guidelines, WHO guidance, and provides a coordinated framework for implementation. The launch represents a milestone in protecting the integrity of South Africa's health system and medicine supply chain. The network that strives to protect public health by sharing knowledge, resources, and best practice for the betterment of our health system. The launch aims to present the National Action Plan framework and its 3 key pillars of prevention, detection, and response strategy. It will secure commitment from the Ministry of Health and partner departments, while also highlighting the critical roles of the steering committee and technical working groups in driving implementation. It will also furthermore strengthen collaboration among all internal and external stakeholders. And lastly, it will actively engage the media as a channel to promote greater public awareness of substandard and falsified medical products and understanding of the National Action Plan. The expected outcomes of the launch include the formal endorsement of the National Action Plan by the Minister of Health, reinforced commitments from national stakeholders and other partners, and the elevation of South Africa's profile as a leader in the fight against substandard and falsified medical products. The event will also secure broad media coverage to raise awareness and strengthen public confidence in the integrity of medicine supply chain and the health system. The National Action Plan against SFPMs strengthen the SAPRA-led market surveillance and control activities. It is therefore my hope that in November 2025, the World Health Organization Global Benchmarking Tool reassessment of South Africa, we will retain our maturity level 3 status. In conclusion, I thank the WHO for choosing South Africa for this opportunity, and we are ready to please set this pilot journey with the member state mechanism on SF at its 14th meeting to be held in November 2026. November 2025 in Geneva, Switzerland. I trust that this will encourage member states to develop their own national action plan using the draft handbook. We are proud of SAPRA for leading this governance structure, and we thank the government department, non-governmental organizations, health sector, industry, and business for their commitment to this initiative. I therefore urge the National Action Plan Committee to continue stronger from here as this action plan journey of implementation, continuous monitoring, and evaluation of the developed 5-year NAP. Regulators on the African continent and globally will be watching and scrutinizing our implementation journey. Therefore, should keep encouraging and continue collaboration, strategize,
Okay, I think it's sustained up to the end. Let's give the minister, yes, give the minister a round of applause. One of the worst nightmares of an event organizer is if there is the Zoom, if it will work. I think we got the essence of the minister, and at least we managed to get his support for this project. Every project of this nature requires a champion at every level of society, right? And at the level of government, if the Minister of Health supports the thing, endorses it, then we are halfway there. So let's give a minister once again a round of applause. This kind of a project really only works where partnerships are concerned. Frank Dialogue, which is the company that is putting together all of this, is also coming in not as just as a service provider, but as a partner to this. I'm not sure why I keep coming across issues of health in my life. You know, when I finished matric, I wanted to be a medical doctor. And I was told my matric wasn't good enough. So I went to Medunsa. Okay, I thought, no, I'll enter here, even if it's a D, you know, matric D. Then they said, no, sorry. You gotta go to University of Limpopo. to do what is called BSc pre-medicine, which is the big four. If you pass them, we'll get you back into medicine second year. I said, let me go. And I failed everything. I only passed something called special English for science students. And my dad said, at least you passed something. But you know, that course, you didn't even have to write exams, you know. If you spoke English well, you'll pass. Then I decided, then they said, oh, no. Maybe you're not studying. Let's send you to UNISA to do BA in English and languages. So my PhD is in media studies. So I still became a doctor, but not of medicine. But I keep cutting across medical field and what have you. Last year we ran as Frank Dialogue 4 dialogues on national health insurance. As some of you here who don't like the medical, so the national health insurance, so we called you to come and tell the minister what you think. You know, but I wanted to share a quick story. Auda Nepad, and I think Auschwitz is here, is my...
I don't believe in coincidence, like God incidents. They said, oh, please come to Ethiopia. There's a conference here about falsified medicine. I said, hey, let me go. I don't know anything about this. I take my team there. We go and film this thing. You know, we cover it. It's a job for us. I meet there a professor. I think it's Professor Village. So if I get to send him a prof, please forgive me. He says, no, no. I lecture at VET as well. You know, I lecture media studies at VET. We talk and talk. And we forget to exchange numbers. Out 50, who was praised over the CEO, who runs his own program, was seen in Ethiopia like joint venture. So this is for him. Can you please get this Professor Baba to come and work with us? He's busy in Ethiopia. We'll get later.
At home, who is going to be? Here's a miracle. Lecturing at VETs, I started lecturing honor students this semester. I didn't have a VET email address. So my assistant established this address. When I come back to Ethiopia, he said, oh, now you've got the VET email address. You know, as a sort of a sessional lecturer here. The first email, imagine what the first email in this email address is. This is from Professor Bile saying, hey, Sapra is looking for you. So I'm saying there's no coincidence. We are in this together. We're going to make this happen. So I can now relive my dream of being some kind of a pseudo-medical. Okay, please, I need all of you to be excited as I am about ensuring that this thing can be raised to the level of the agenda. I'm going to ask our colleague from WHO, Hiti Silo, who is WHO Regulatory and Safety Department, to come and just give us a broad outline of the approach from WHO as we now prepare to get into our panel discussions. We're going to lay the tone. If the presentation is ready, please line it up there. Mr. Silo, the stage is yours now. You are going to lead us into the panel discussion that's going to get the dialogue going. Thank you very much.
Thank you. Thank you very much, Prof, and very good morning. I'm very happy to be back to my continent, and particularly here in South Africa. And I must admit that I have moved to Geneva in 2018, beginning of 2018, so almost 8 years now. And every time I come back here on the continent, one thing that I miss most, and I want to thank you, Prof, and I hope there will be another round, is the way we started, actually, the business here. The dance this morning, the little music that you started with, I think that is very close to my heart, and I was very happy that we started with that. So I hope we will have some other round before we leave this place. Because those are the few items my sister Shinaz knows that those are not available in Switzerland. So thank you very much for inviting WHO HQ to be here at the launch, and this subject is very close to my heart because, as you can see in the pamphlet, there I have been a regulator in Tanzania, and my last job being the CEO of Tanzania Food and Drugs Authority. I have been involved with this business from the early days of my career, but also at some point also representing the African region to the WHO steering committee on of the member state mechanism on substandard and falsified medical products that the Honorable Minister very clearly spoke about, until when I moved to WHO. That's when I stopped being member of the steering committee that I served for almost 4 or 5 years. And I have put together some few slides. I hope they will be projected online. That I want to speak to, and that we are seated here today to confront a global health threat that undermines trust, endangers lives, but also demands a united action. And that's why we have the National Action Plan launch here. We all know that substandard and falsified medical products are not just a regulatory failure, but they are a moral and public health emergency that calls for a shared responsibility among the key stakeholders. Let me know if the slides are out. I have 3, 4, 5 slides that I wanted to speak to. So as the slides come out, I just wanted to start by drawing your attention to the remarks by our WHO representative, my sister Shinaz, on the outcome of the socio-economic impact on substandard and falsified medical products that was published by WHO in 2017. The numbers that she highlighted in her speech speaks volumes in terms of the percentage of products that fail quality tests when they are subjected to screening and full monograph analysis in labs with regards to substandard and falsified medical products that account for 10.5%. And those are the statistics of 2017 based on the 10-year retrospective study. You also heard, what is the waste of resources in terms of the dollars that are actually wasted by purchasing or procuring products that are substandard or falsified, and therefore clearly indicating economic loss, but also waste of resources, out-of-pocket spending on products that do not work, high disease prevalence, but also progression of antimicrobial resistance, which is also a global threat. But when substandard products or falsified products are actually dispensed to patients, and if they don't work, for serious diseases, people die. And therefore, it is as serious as that. And I think you also heard from the previous speakers the incidents that happened in the Gambia, in Indonesia, but also Uzbekistan and other countries between 2022 and 2023. The interaction between multiple stakeholders, the National Regulatory Authority, in this case, customs, border authorities, police, criminal justice practitioners, all these are very instrumental in prevention, detection, and response to substandard and falsified medical products. And therefore, we are very happy to see that South Africa was brave enough to lead the process of the pilot that is based on the draft handbook that WHO put together, and that the lessons from this pilot will actually inform us in terms of finalization of the handbook. So I also wanted to just briefly highlight that SF medical products are likely to reach patients in situations where There is constrained access to quality and safe medical products. There's poor governance, and there's also weak technical capacity in terms of regulating quality, safety, and efficacy of medical products. Although this issue calls for all countries, it impacts all countries. Countries where there are weak or non-existent regulatory systems bear the greatest burden of substandard and falsified medical products. And we have also cases during the COVID-19 pandemic that we had incidents of those products being falsified. We do recognize the role of the interagency collaboration at the national, regional, but also at the international level to tackle SF medical products. And we are gathered here at the national level, but also, as you heard from the CEO, the African Medicines Agency is kicking off, and therefore one of its mandates is also to coordinate continental strategies to combat substandard and falsified medical products. At the global level, through the member state mechanism that Honorable Minister clearly articulated too, we are coordinating the efforts across the globe with the member states to ensure that SF medical products are addressed aggressively. So I also recall that in this, I have been informed that in this room we have got also representatives from the SADC region, and I want to thank them for being here, and I hope them being here will also inspire the putting together also the national action plans in their respective countries. So I just wanted to speak briefly about the national action plan before I wind up. The handbook that was referred to by our WHO representative, but also by the minister and other speakers, is actually designed for all stakeholders involved in SF and combating SF medical products, and ensuring that only safe, effective, and quality-assured medical products enter the supply chain. South Africa's launch of its National Action Plan reflects united commitment to protecting public health through quality-assured medical products that will be in use in South Africa. The pilot, okay, the slides are here now. So this was my first slide, just to confirm to you the numbers that our WHO representative has actually highlighted in her remarks. Next slide, please. And so this is the same, the social products. Next slide. Next one. Yeah, so I have already spoken about prevention, detection, response. That this is a holistic strategy that involves multiple stakeholders in terms of responding to this global public health problem. Next slide. So these are the forces that drive SF products getting to the market. Can go next, please. It's quite a busy slide. So constrained access, poor governance, but also weak technical capacity. I think I have also covered this slide, and I'm sure the slides will be shared with you. These three major elements that actually contribute to SF products getting onto the market. Next slide. And I've also spoken about the international, the need for international cooperation against SF medical products for prevention, for detection, prevention, and response across the national level, regional, but also at the global level. Next. So now I'm speaking about the WHO Handbook for National Action Planning for Prevention, Detection, and Response Strategies on SF medical products, and you can kindly move me to the next slide. That's where I was when yeah, thank you. Just remain there now. So this pilot that was led by South Africa is actually intended to assess whether this handbook is clear and user-friendly in its structure, language, and layout. But it also assesses whether it offers practical guidance for developing a national action plan. It also checks whether the reference resources adequately support countries in this process. It also checks whether additional examples or tools are needed on how beneficial they will be, and also if any parts of the prevention, detection, and response framework need further clarification. And lastly, South Africa's if actually in the pilot South Africa faced specific challenges or barriers during the National Action Plan development process, that can be taken to other countries. So on the next steps after this is now launched here, as we heard from the speeches, South Africa will actually be sharing the lessons from the pilot to the WHO member state mechanism plenary that will be happening in Geneva in November. And as you might be aware, that the outcome of the plenary goes to the Health Assembly. And that's where final decisions are actually taken. So it's a critical action that South Africa has actually agreed to be the pilot, and that the lessons will inform also the finalization of the National Action Plan. We will then continue supporting the ministry, but also SAPRA, and also stakeholders in implementation of the National Action Plan here, and to ensure that we will, with support of partners, this action plan is adequately resourced to guarantee long-term sustainability, but also finalize the draft handbook, as I said, based on the lessons here, and begin supporting other countries and of course WHO regions for the rollout and for them to put up their own national action plans. So basically this will have a global impact. So before I conclude, next slide please. I just wanted to share this very busy slide. I think regulators in the room might have seen this slide many times. It keeps getting updated, but and this is the statistics of the global status of national regulatory capacities based on the global benchmarking tool, but also it also includes countries that are actually recognized as WHO-listed authorities. Currently, we have got 39 of those authorities, and some of them still on the transition to become WHO-listed authorities. This is the highest level of performance, but also those that are at maturity level 3, 8 of which are in Africa, including South Africa, and which is for vaccines. And of course, it was mentioned by the minister and CEO. I heard the ministers ask for maintenance of ML3 for vaccines, but also an assessment for the medicine side of things. But still, we have 31. This is only 61 member states, and which accounts for 31%. But we have the remaining 133 WHO member states that still we have NRIs that are operating at mature level 1 and 2, and therefore we still have a lot of work to do. My message here is that national action plans alone are not enough. Robust regulatory systems are the foundation of a well-functioning healthcare system. And WHO applauds South Africa, as I said, and 7 other African countries, Tanzania, Ghana, Nigeria, Egypt, Rwanda, Senegal, and Zimbabwe, for achieving a stable, well-functioning and integrated regulatory system that is equivalent to mature level 3, according to the WHO Global Benchmarking Tool. We also know that weak regulatory systems cost lives, and the incidents that happened with cough syrups in the Gambia, Indonesia, and Uzbekistan in 2022 and 2023, I think are clear reminders that we need to take actions. And implementation of the national action plans also complements addressing the indicators. And I was very happy to hear that the minister speaking about one of the regulatory functions, market surveillance and control in his speech. And that implementation of this action plan will actually help SAPRA to address some of the indicators that are looking at market surveillance and control, and therefore keeping you ready for becoming a ML3 also for regulation of medicines. My last message to the stakeholders in the room, I ask for your expertise, collaboration, and of course dedication, which are vital to the success of South Africa's National Action Plan implementation. Let us embrace this moment to reaffirm our shared responsibility and unwavering commitment to protecting public health, not only in South Africa, in SADC, in Africa, but also globally based on the lessons here. So with that, I want to say thank you once again for inviting WHO and for inviting us to be part of this process, and I look forward to the next steps, and I hope that the lessons from here will truly guide us as we move to the other countries, but also to other parts of the world. So thank you.
Let's give him a round of applause. They were lovely slides. I see why you insisted they must be played. Beautiful. Yeah, I was corrected. It's Professor Padayaji. Is Professor Padayaji here? Yes. Sorry, Prof, to get your name wrong. That's the chairperson of the steering committee who found my vet's email address. By just going to the vet system, it says @vets. Hey? Now we're going to go into the panel. Gordon, please come and entertain us. Give us one item while we put the hot seats on the stage here for our panelists to come. It's going to be a very dynamic panel. I look forward to it. Gordon?
If you have your food, you don't have to leave it behind. Please come in with it, with your drinks, and we can start. Ladies and gentlemen, I'm also going to start asking those who will be part of the panel to please come forward. And the names are as follows: Dr. Francis Magombo, Mr. Vincent Tala, Ms. Daphne Mohadi Fafudi, Dr. Stravos Nicolaou, Ms. Tavendri Tamigopal, Dr. Francis Magombo, Dr. Stravos Nicolaou, Mr. Hiti Silo, may I ask the names that I've called out to please come to the panel for the second part of this discussion. Dr. Tabir Pashe. Okay. Miss Chimwemwe Chamdiba. Miss Chimwemwe Chamdimba. Miss Daphne Mokhadi Fafudi. Dr. Anbai Pillay. Ms. Tavendri Tammy Gopal. Dr. Stravos Nicolaou.
Dr. Stavros, waiting for you. He seems to have disappeared.
Okay, they say he's on his way. If I may ask those who are still standing there to come in with whatever it is that they have, whether it's their beverages or bills, they can come through with them. Thank you. And I hope I have everybody's names pronounced correctly. That's it of me. Thank you.
Thank you. Please let's give a round of applause to our panelists. All right, thank you so much. What we're going to do is try to get a little bit of from your vantage point, right? All of you are from different organizations. This campaign is that one thing from your vantage point that you believe will kickstart this plan of action, will make it realized? You've just given us a broad overview. I want us for you to kick us off, Mr. Silo, to just give us a sense of, if you were to pick one thing to be done in terms of prevention, in terms of detection, in terms of response, what would that
I'm happy. Holders will have to play a specific role across those three pillars. And for me, speaking on behalf of WHO here, these three pillars are built on a strong national regulatory system. And we're using the word national regulatory system because it is not only about SAPRA, it's the regulatory system in South Africa that has many stakeholders, the government entities, but also the role of the private sector. So for me, SAPRA being a robust, strong regulator in the country, for me, it ticks all the three areas. So that is the starting point. And then working with the partners in the context of the National Action Plan to address this problem holistically.
What you got a what do you call it? Is there a playbook? Not a playbook. Handbook. Hopefully not a playbook. What stands out in this playbook, right? That in your view, WHO thought South Africa should pilot it. I'm curious about that. You could have gone to anywhere else in the world.
Yeah, good one. So yeah, we had definitely several candidates that we could have picked for this pilot. But the reason is the readiness of the country, and particularly the leadership of SAPRA in championing regulation of medical products on the African continent. And when we looked around, particularly because we wanted to do it in Africa, and it was eminent that SAPRA represent South Africa in this case was the best candidate. Just for your information, the CEO here chairs the steering committee on African Medicines Regulatory Harmonization Initiative, AMRH, and therefore she oversees all the areas, all the 9 regulatory functions, and therefore having this pilot in South Africa, in our view, was the best place to have it, and the lessons here will definitely be taken up by other countries because of the leadership that South Africa has in regulation of medical products on the continent.
Yeah, that's a lot of pressure on the government. What is the government going to do to champion this cause? You know, because of course there are lots of other competing interests. I mean, you are in the midst of litigation around NHI. You know, there's a US pullout of funds, etc. What are you going to do on this one to be, in a sense, the champion of this action plan?
Thanks for the question. Yeah, I think there are probably 5 areas that substandard and counterfeit medicines and falsified medicines fall into, and where the opportunities exist for such products to gain traction in the market. The first, I think, is at a manufacturing level. So in a country, you've got to have a system where manufacturers are licensed. So you can't have somebody getting up tomorrow, setting up a plant in their garage and deciding to produce medicines. And I think in South Africa, we've got that right. We have a regulator between SAPRA as well as the Pharmacy Council who license these manufacturers, so that you can't just get up tomorrow and say, I'm making medicines. Yeah. There's a clear system by which you must comply in order to start producing medicines. The second is, I think, at the level of importation. So a lot of medicines are produced overseas. And so the question is, when those medicines enter the market, is there a system in place to be able to detect and identify whether this medicine will be permitted to be sold, meaning does the regulator approve that? And I think we've been very fortunate in that from the days of the MCC, and I'm glad Mandisa is here as well, they've been very good at making sure that products that are substandard, that are counterfeit, etc., didn't enter the market. And I think within SAPRA, while there are challenges around timelines, etc., we've never ever had a complaint that somebody in SAPRA will receive a brown envelope and at the end of the day will register a medicine. That doesn't happen. You'll never hear that complaint. Yeah. And I think that's something we should be proud about at a regulator level. Then I think where the challenge lies is at the reimbursement level. So the CEO spoke about the GLP products. Now, these are products that usually are not reimbursed by a medical scheme or not provided for in the public sector. Somebody wants to produce a substandard product or a falsified product, it's the perfect place because those products can be produced and there's a market for people who want it. Viagra is another example, right? And you would find in areas where those types of products are likely to be sold, there would be those kinds of products entering the market. So I think in South Africa, introducing, for example, a national health insurance, since you brought it up, is important because if you have a single purchaser who is purchasing these products, the opportunity for a falsified product or a substandard product is minimized because the state is now taking responsibility for the procurement. So nobody needs to then go out and seek a cheaper product or have any engagement about alternative products. Everything's defined effectively through that package. And then I think at the level of the pharmacy or the dispensing doctor, clearly the South African market doesn't allow somebody to open up a shop and start selling medicines. In other markets, that's a problem because then what then happens is that these producers of these substandard products then sell their products through those outlets. Here we have pharmacists who are professionals, doctors who are professionals, and it's very unlikely that they're going to allow such products on the shelves because the consequences for them are quite serious. You have the Pharmacy Council who will then deregister them, etc. So I think we have a very good system in place. Where our biggest risk is in substandard medicines.
Yeah. But where are the gaps? What's causing the gap? Would you say that maybe the issue of pricing of these medicines is what is creating the black market? Would I be right to suggest that? I was just told, my sister was telling me that there's a cancer drug that is a shot per shot is something like 70,000. It's a bond.
Yes.
70,000 per shot, and you need that shot every month for the rest of your life, right? Now, isn't that a gap then for somebody to go to India or wherever these things are manufactured and sell that drug that's otherwise 70,000 per shot for 10,000 a shot?
Yeah, and the reason that person would do that is because either they don't get it through the state or the medical scheme doesn't cover it. Because if it was reimbursed in some way, there's no need to go anywhere, right? And so that's why I come back to the point of reimbursement. If it's not reimbursed, that's the opportunity where that occurs. But I do want to address the issue of substandard medicines.
Yeah.
In 2010, when we were addressing the huge cost of medicines, particularly ARVs at the time, I went to a country, I won't mention its name, engaging with the manufacturers to say, can you produce products at a lower price?
Yeah.
And what the manufacturer said to me is that, tell me how much you want to pay.
Yeah.
I said, why you ask the question? He said, well, I'll make it so that you can afford it. So I said, what does that mean? He said, I'll put in as much as ingredient as you can afford.
This is not India. Just to eliminate. That's a process of elimination.
So really, at the end of the day, you need a regulator that makes sure that the content of the product is what it said on the label. Otherwise, I think we have huge problems.
That's where SAPRA comes in, Stephanie. Are you efficient as the regulator to ensure that there's no lag between somebody suggesting this product could be useful for breast cancer or whatever it is, to the point where it's approved, so that there's no space then for people to go and look for it in Mumbai?
Let me ask that my CRO, Mr. Temi Gopal, take that one. No, it's not, but she will answer it better at a higher level than me. And then remember, I'm market surveillance and control, and then I will speak
So
directly.
you tell us why there's not been control over all these years. I'll come to you, back to you. You answer that one for me, please.
Okay, thank you.
Yeah,
I guess I
with the
can't refer
official.
it to the CEO. I'll have to just answer it.
Please answer.
I
He's
would
going to fire you otherwise if you can.
Yes, I would say we are, as SAPRA, efficient, but there's always room for improvement. So where the substandard and falsified actually comes in is when there's a demand for the product in the market,
Yeah.
and maybe registration is not happening as fast as it should.
Yes, I'm told sometimes it
We
can
do
take
have-
18 months. Is that true?
Yes, or even longer.
Oh,
but
no.
we do have
Yeah.
pathways called priority review pathways,
Yeah.
where applicants can then apply for the special expedited review pathway to have your product reviewed by the regulator, and we look at it as a case-by-case basis, depending on what the guideline outlines, unmet medical need or for whatever
I see.
reason.
Or life and death situation where there's a patient
Absolutely.
who can benefit from that product until SAPRA approves it.
So in
So
that
you won't make that person wait for 2 years.
Yeah, in that case, then, if it is a special need for a patient, we
Yeah.
have a Section 21 process. So if a product is unregistered in the market and the patient needs it immediately, the healthcare professional can apply for the product to be used.
All right, let me come back to you now in terms of the regulation. You've been telling the country ahead of this dialogue that there's a whistleblowing line that has had thousands of people complaining, right? That shows me that there's a particular gap. What I understand as the gaps in the regulatory framework that this campaign can solve.
There will actually always be many gaps, hence the development of the National Action Plan, being it a multi-stakeholder requirement. Because remember, to implement, there is a connectivity. Our supply chain, we've got very good regulatory frameworks, legislation.
Yeah.
However, they are dependent on each other. They cannot run parallel. You can't speak about Customs Act, you can't speak about the Pharmacy Act, you can't speak about the Medicines Act, you can't speak about the National Health Act, you can't speak about all the stakeholders that are in here, legislation, without connecting us together. So our gaps in the Medicines Act are supported by the feeling from the Pharmacy Act,
Yeah.
and also from the other the Border Management Authority, which we've got an MOU with, for example. So all the stakeholders that you see them here, from global to SADC, we've got complete attendance today from all the stakeholders that we've been engaging in the past plus minus 2 years in getting this to what it is today. So it is the beginning of the journey. We've got a document together, colleagues. Now we have to take this document and put it in action for the next 5 years. And as the minister and the CEO said, so now the globe will be watching us. The continent will also be watching us to say, okay, this is what you introduced to us. So how do you now fill in those gaps? But what we did, we prioritized. We had to look at the low-hanging fruit and as a collective to say, okay, together, what are those that we can tackle within 5 years? So that is our approach, Prof.
Okay. Please engage here on that. What would be, in your view, signs of success? If we were to say in a year's time, before we get to 5 years, because half of the people who are here would have retired and won't be around to account. Just next year, what would be one or two things that, in your view, will start to show that we are pushing back against this crisis?
No, thanks, Prof. From our side as South African Farmers Council, the first thing which is important is to educate our people to buy medicines from registered pharmacies and reputable retailers. If you're going to buy from a spaza, and you might not know if this is the right product, particularly when we talk about scheduled substances that are only supposed to be sold in pharmacies. So it's to educate the members of the public to say.
To also make a distinction, because sometimes people don't know. By the way, the spaza you're talking about could be online. People say, no, this thing will enhance your performance. Please click here quickly. You will be strong. And then you order that, but that's part of the falsified medicine. He mentioned Viagra. Do you want to dwell on the example?
It doesn't matter what the medicine is.
Yeah.
I think from our side, even if it was for headache, it's important that you buy it from the right retailer or the pharmacy. Because then you are guaranteed that these people are the ones who are supposed to sell the products and understand the product much better. And if indeed it is a false product, they will remove it off the shelf.
But I haven't come across a lot of education initiatives from pharmacies. I mean, I don't think they bother much to explain to people. When you get to the pharmacy and you see a medicine on the other side, and you say, can I have that? There's no, where's your prescription from a doctor? In some, they say, no, you can't even give them an email prescription. You must bring a physical thing, etc. You seem to be mentioning the education thing as a key thing, but do you agree that more can be done by both your association and individual pharmacies to educate people about what medicine is scheduled, what medicine can be gotten over the counter and not?
I agree, Prof, that more can be done. And I think as we speak today, we are celebrating Pharmacy Month, where we spend
is that the
time
case? I had no idea.
to educate pharmacists around that. And I'm sure for those of you who follow media, you would have heard me on Power FM and 702 speaking to our people about where to buy medicines. And ask your pharmacists, one of the key important issues that we say to the members of the public, when you get there, just don't demand the medicine. Ask the pharmacists, because they are knowledgeable. They would be able to tell you how to use the medicines, where to store it, and all the related factors.
Yeah, you must go to Alex, because the people you are talking to already have doctors and specialists and medical aid. I think you need to go to those ones who actually don't have. But we appreciate the work that you are doing there. on the issue of detection, isn't that if you like, the detection crime scene is really at the pharmacies, where you have all those medicines that are not behind the counter, where somebody can just pick them up. Is there a gap there where falsified or substandard medicines could be sold, because you don't need the prescription for some of those?
No, it's law in this country that a pharmacist or a pharmacy can order anything
Substandard.
that is not substandard.
Yeah.
So it is a requirement. That's
Whether it's
why
off the shelf or not.
Yes,
Yeah.
it doesn't matter. Even if it's grandpa, it is a requirement that they make sure that when they buy the medicines, one, it's from a registered manufacturing facility or even the wholesaler. So they are not supposed to, a community pharmacy or a hospital pharmacy can't just import medicines outside the country. They have to buy from registered manufacturing facilities and wholesale pharmacies.
All right. No, thank you very much. Please pass the microphone there. Yes, please weigh in. In terms of intercontinental, there are a lot of initiatives. I mean, in Addis Ababa, there was, various committees set up and so on. So clearly, there's a linkage between what we are dealing with, an issue of maybe uncontrolled migration or porous borders across the continent and so on. Please weigh in on that for me.
Thank you very much. I think I'm the only person whose photo was not projected here. I'm representing my boss. I'm from the African Union Development Agency, NEPAD, and I work under a program known as the African Medicine.
Yeah, we apologize. She couldn't make it. Yeah, all right.
Yes. So from the African Union side, what we are doing is we've recently launched a continental plan on the fight against SFMP, which you talked about, the one that we launched in Ethiopia. And what we do at the African Union is to identify areas of priority, as well as put together strategies that bring together the countries on the continent so that they can work together. And so far what we've done is with the Continental Working Group, which SAPRA, by the way, is represented. I think it's in one of the sub-working group, if not the working group, the Continental Working Group. And what we do is, so we've established 3 sub-working groups under this continental plan as a way of implementation. And one of these is to have an area where we do research, we collect data and share information with the countries, because with SF, if you don't work together, then you can't fight it. Because the only way of countries like South Africa to have an efficient way of fighting against substandard is for South Africa to work with other countries. Because I think it was mentioned here in the morning that borders are porous. And yeah, if you do not control in the neighboring countries, if you do not work together to also make sure that the products that are circulating in the neighboring countries, they will definitely get into your market. Yeah, so what we do is make sure that the countries work together, we bring them together, and we have these discussions where they agree on strategies to fight against SF.
Can you give me a case study of where this kind of action plan initiatives has worked and is something that we can look at? I know there were a number of case studies shared that in Ethiopia by various countries. Can you share one that you think we should look towards as we try to implement this in South Africa?
I think it would be easy for me to refer to a country where I'm originally from, where I worked in, Tanzania. I think we all know this is a multi-sectoral kind of fight. You cannot have only the regulator doing the work. You cannot only have the police service doing the work, not the judiciary, not the board, the borders management authority. So I know, for example, I remember some years back in Tanzania where a national plan of this sort was also launched, where we brought together all the stakeholders, all the key players, and we were able, this plan was launched, I think, somewhere, my former bosses here would confirm, somewhere around 2015, and by, I think, 3 years after the launch of this plan, a study was conducted where we were able to see a reduction in...
Reduction, yeah, and was it a significant reduction, like 50%?
I would not say significant, but yeah, 50. A reduction, not 50.
Not
because
50, all right.
Yes, not 50. I think it was reduced from 15 to 11. So it's a 4% reduction, which is maybe significant when you talk about these issues of SF. Yes, yes. And I think what worked is bringing all the stakeholders on the table and agreeing on the roles for each one to play. I think this is what I would advise in the implementation of the national plan for South Africa.
Wonderful. Now, I think we'll have to push for a bigger reduction, because the numbers that I had were quite frightening. Because you need to link the numbers to the possible impact. If somebody gets wrong medicine, that could lead to death. That could lead to all sorts of things. Right? So it means that the more you have medicines floating around, the more danger. Dr. Stavros, please weigh in from a point of business. You guys are the ones who are manufacturing these things. So what are we going to do to weigh in?
The first thing is to get the mic working. That would help.
Okay.
Okay, JJ, I want to make a couple of points as prefacing remarks as a lead up to the question you're asking, right? So let me start off by saying that our country has many socio-economic scourges that it is dealing with. And this is a new one and a very sinister one. And we need to take it extremely seriously. This has an impact both at a public health level, but also at an economic level. And our country simply cannot afford this. The public health outcomes, or lack thereof, in many instances, are obvious. Patients die, and we've seen this in Europe and other countries, if they take falsified medicines. Even worse, one of the things we're really grappling with in health around the world is something called antimicrobial resistance. AMR, it's called. And this is when there's an overprescribing of antimicrobials, or people are taking antimicrobials haphazardly, and then you develop resistance, and then eventually you run out of antimicrobial choices. It's a really, really concerning problem. Now, if we are administering falsified drugs to patients, and they think they're getting the real deal, and they're not, those patients will develop resistance as well. And then the problem escalates from there. Okay. Now, another dimension and element is we have amongst the highest unemployment rate in the world. We desperately need to attract investment, foreign direct investment into our country. And if we cannot properly secure and enforce the law, investors will also lose interest. So companies will say, instead of introducing new cutting-edge technology, is it worth me risking this if it can't be properly enforced? Now, it's not a problem unique only to South Africa. It's a global problem, but it's one that we need to address domestically, continentally, and internationally. Okay, now, you asked us for one thing that will move the needle on this. Okay, I'm going to give you 3 quick ones, because it's not possible just to give you one. The first thing is we need to educate the public, but we need to educate our own profession. It is so disappointing for me to sit here as a healthcare professional and I see the extent of compounding that is going on by my very own colleagues. It's unlawful, and they are doing it with impunity. It's wrong.
So there isn't enough consequence management around almost, if you like, clamping down on the issue of falsified medicines.
Yes, I think we need to educate, and then we need to enforce. So that's my first point, is education shouldn't only be to the public, but I think we have to almost educate the professionals as well.
There isn't enough of that going on.
Correct.
Yeah.
Correct. Number 2 is enforcement. Okay, now I'm so happy that SAPs are here today. I think there's a colonel there that I saw earlier. Okay. And what's good is Minister Firoz Kachalia, the newly appointed Minister of Police, is becoming seized with this. Because it's one thing educating, but people still act with impunity. And the only way you're going to stop people acting with impunity is if there are some high-level raids and people are put in the courtrooms. So the minute perpetrators...
Where at the manufacturer or at the point of source?
Throughout the whole value chain.
Value chain, right up to...
Throughout the whole value chain.
Up to the pharmacies themselves.
Everyone involved, okay. And there's been a particular proliferation in recent months because of a new class of drugs. These are called GLP-1 drugs and GLP-1 combination drugs. They are used primarily for diabetes, but they also have great success in weight loss. Okay, so now it's caused an absolute proliferation, unfortunately. I've been in this industry 40 years. I haven't seen this level of proliferation in SF, counterfeit, fake, and compounded medicines. I was speaking to my colleague from Novo Nordisk, and we think that there are 50 to 60,000 patients that are receiving compounded GLP-1s.
But they receive it from who? From health professionals, from doctors?
Compounded pharmacies, yeah.
From pharmacies,
yeah.
okay.
Okay. Now, the law doesn't disallow compounding, okay. It's rather something that is tailored for a particular patient by a doctor, not this mass compounding that we are seeing. Okay. And there's, this morning, I'm going to name and shame because this is part of it, and I will, I will face the music, okay, afterwards. There is a compounding pharmacy called Idexa. I saw Idexa.
Yeah.
I saw their advertising on social media this morning. It was sent to me.
Yeah.
Okay. This is not promoting responsible medicine, I'm afraid.
What are they advertising?
So they're advertising these GLP-1 drugs.
Okay.
So I'm calling for enforcement. Now, SAPRA on its own cannot do this. Okay. I mean, SAPRA is juggling a million balls. This requires a task team across SAPS,
from law enforcement,
the Hawks,
yes,
SARS, customs, because a lot of the problem, where's a lot of the fake GLP-1s
they
coming
come through
from?
the airport.
From China. Okay, we've picked that up. Seeing that you were naming and shaming countries, let me name and shame as well, JJ. So,
yeah,
customs must be involved in there. Customs, SARS,
yeah,
the professional statutory councils, the pharmacy council, the healthcare professions council,
okay,
for SAPRA, industry, and the professional associations all need to work together because there are 5 acts, there are 5 laws. There's the Medicines and Related Substances Act, there's the Counterfeiting Act, there's the Criminal Procedures Act. I'm not going to mention all of them. Okay. So the law is there. We just need to enforce it.
Yeah.
And I'm not into Hollywood-style raids and seize and desist.
Yeah.
But the minute you start making some high-profile examples publicly, deterrence is a very, very good way of enforcement as well.
Absolutely.
Now, let me make my last point, because I said there were 3. Okay. I think what we need to be acutely aware of, and I do need to, at this point in time, commend and congratulate both the WHO, the Health Department, and SAPRA, and all the other stakeholders involved in this important initiative. It's long overdue, and it is a critical initiative. Okay. Because in any country, the minute society starts losing faith and trust in the integrity of the medical value chain, then you are a society in trouble. A society in deep trouble. Okay. And we simply cannot afford that. So we need a task force, I believe, a special task force. SAPS and correctional services know this a lot better.
Yeah.
I left out one other key stakeholder, I'm sorry, it slipped my mind, and that's the Department of Justice.
Yeah.
Okay. Justice and correctional services. They need to also be involved. And we need to set up this task force with speed. Minister Kachalia is on board, I believe, because he's been speaking about it. And he's asked to meet imminently. And we need to start bringing culprits and perpetrators to book. I'm tired of walking into a gym and a guy standing next to me is selling anything and everything to an unsuspecting gym goer. And
Yeah.
I mean anything, and from inhaler, you name it. It's not only the Viagras and the it's like a shopping list, and it's done with impunity. So my final message here is, industry, who I'm representing today, through the Pharmaceutical Task Group, which represents 90% plus of the pharmaceutical industry, are fully supportive of this launch, this campaign. There is a handbook. The handbook is most welcome. We'd like to give Tumi some additional inputs into the handbook. Tumi spoke about accountability, keeping each other accountable, and I think that's a very important aspect to dealing with this. It's going to become a crisis soon, if it's not already. It's a scourge of society
Yeah.
we need to eliminate.
All right, thank
Thanks
you.
very much.
Thank you very much. Please give Dr. Stavros a round of applause. Please, can you pick up on what he's saying? Who should bail the cat then? There's a suggestion for a task force there, right? But you know, a typical story of everyone, anyone, anybody, and so on. You know that story, where nobody will do it. Next day we'll say, oh, where's the task force? Please pick it up on there, and then you can also make your own input.
Thank you very much.
Yes.
I hope it's. And I think Dr. Stravos have raised critical points when it comes to looking at the issues of substandard and falsified medicines, because it is not only just a regulatory or enforcement problem, but it is a public health risk that we need to address. And I think what gives me confidence is the NAP that we are launching today, and in a way that we came about doing it, because it's one of those that we had all the stakeholders that he mentioned actually being part of the genesis of it all. You know, it's one of its nature that we're piloting what we want to do, and we've tested some of the things that we want to do in terms of this action to be able to can address the issues of SFs as well. And it's important to recognize the fact that for us to be able to can do better with prevention, we do need an informed public, yes. So we've seen that there are platforms that has been existing, like we've said that there is a whistleblowing in SAPRA and all that, but those needs to be extended in a way that the public knows. For those that are not able to call, we need to ensure that it goes further to our communities, because if we can get the communities being aware, especially those that are in remote areas, to be saying, how do I identify it, how do I report it, because that's how we're going to build that system that is transparent and also be able to can hold each other to account. So within the framework of the NAP itself, we do have the task teams that have been working there, the technical working group and the steering committee that are inclusive of all the stakeholders that were mentioned there. And it is to now drive with the resources that we have, with where we have begun to be saying, let us strengthen in there. There are various things, even within the Provincial Department of Health, where they're doing the risk communications and community engagements. You did allude to the community radio stations that we need to get into to educate our people to know what to do, because the moment that they are aware and they know how to report, that's how we're going to even assist when it comes to the enforcement. It shouldn't be just at the entry points where we're looking at, but it should be within our communities as well where we're looking. We are faced with these e-commerce, with these social media markets that we have, and we need to be able to can say, even in those spaces, how do we infiltrate to make sure that we've got systems that will ensure that we curb on those adverse that comes across, and then we'll also tell the people that this is not the right way to go and this is how. How do they recognize on that? So the importance of everybody that is in the room, but most importantly, everybody that is affected by this problem that we are faced with, and the stakeholders that we brought together to then bring to life this NEP, because it is not just the end of this when we started, it's the beginning with this launch, right? Because the success of it will be in how we measure ourselves with seeing the improvement with the SF, because it erodes trust. Every mother out there in the community, when they give their child any medicine, needs to have the confidence of knowing that I'm giving it the right medicine. It doesn't matter whether they got it in a local clinic or somewhere in the corner, but it needs to be safe. So all of us, it requires all of us that are affected and that are in the room, especially the stakeholders, from the prevention, from the detection, from the response, to actually strengthen the system that we have. And also to have a national collaborative system where when we report, we're able to know what is happening in Northwest, what is happening in Gauteng, what is happening in the Western Cape, but the response and the process needs to be such that it is standardized across, and we're doing one thing, because that is the only way that we will send a message across that can say to the community, we've got trust in what now the health department or in what SAPRA or in what industry is bringing to us in terms of the safe and effective quality medicines that are consuming. Thank you.
In your view, what should be the coordinating point for that kind of action? Because there's a lot of stakeholders, and maybe they are already doing some of those things, but in a more so it's not in a coherent manner, right? So how will, in your view, this plan change that? Because some of the things that you are raising, one would think are obvious, that if you are in pharmacy or you own the pharmacy, you'd have to educate your customers about what they can get, what they can't get over the counter or straightforwardly from your shelves, for example, right? But it looks like there isn't a broader national education about this. How can that be resolved so that we don't come back after a year or after 5 years and these things there still haven't had an impact that we need?
Thank you. So the NEP itself provides for that, because it's a framework that brings in all these sectors. So it brings in health, it brings in the enforcement, justice, it brings all those. So as a multi-sector, at a higher level, that is where it's going to. The steering committee that have been put together, in fact, come from those different sectors, from health, from what. So it's going to be that body that will coordinate to see. And the technical working group down to the provinces and on the ground is where the work will be done, and it's going to culminate to the steering committee that is a multi-sectoral from the various departments. So that is in essence what this book that we are launching today as part of the campaign as well, is what we have the confidence in saying. Now it brings everybody together, and each one within there would know what their role are, and we would know where this go in. And you did mention even earlier on to be saying, this requires champion even from a higher level. So the political support that we now have through the ministry is what we're also relying on to be saying, from the various ministries as well, as already been mentioned even by Dr. Nichols, that we need those ministries as well to be in there. But the start was with the Ministry of Health that were there, but we had representatives from the sectors. But this framework that we are launching today is actually what we're going to do, because everything will be guided in there, even with the evaluation and monitoring of it in terms of where we are.
All right. I know we hijacked you earlier with a question, but can you pick up on the issue about, she talked about the steering committee. Would the responsibility, for example, to implement the suggestion that Dr. Stavros put on the table about a task force be initiated from the steering committee? What do you see as the next steps? Yes, we launched, it's going to be all over the news for 2 or 3 days, and then there may be silence for weeks and months after that.
Thank you very much. No, so definitely the NAP, as my colleague has mentioned, will give legs to this task force that Stavros has discussed right now. But I think the next steps, I think each of the stakeholders on the NAP do have their own activities. For example, SAPRA, we have our activities for the next 3 to 5 years. And some of the things that the media or the public may not necessarily know is sampling. We are increasing sampling in the market, where we pull out product samples, we test, and that's called post-marketing surveillance. By doing that, we're able to identify substandard and falsified. Can we do more?
This is unannounced visits to places.
Yes, unannounced, and my inspectors are in the room. They can possibly just wave This team is actually in the coal face.
Okay.
They go into
Where
the
are the
dark.
inspectors?
Thank you. There they are.
All right.
They actually go into the dark and dingy places and get threatened, but really do.
They
what
get
need-
threatened?
Yes, they certainly get threatened.
Wow.
So,
Yeah.
but certainly they do what they need to do. So the sampling is one. SAPRA hopes to have our own laboratory in a few years to increase the frequency of the sampling. I want to just touch on education, and I
Yeah.
think that's a topic or a term we're using very loosely.
Loosely, yeah.
But there's education of the public. But then, interestingly enough, I go to my pharmacovigilance team and I said, if this is the proliferation that we're seeing in the market,
Yeah.
what is the extent of the adverse events that we're getting? We're not getting sufficient reporting. And when we do get the reporting of these adverse events, the patients are very reluctant to share details of where they're purchasing it from. So they're actually protecting those that shouldn't be selling the substandard and falsified. So can we do more as a team, as a task
Because
force?
they feel those people did them a favor by
Did
giving them
them a favor.
on the cheap.
Exactly, yes. Especially now if it's the GLP-1 and the weight loss, that's a positive. But you're actually sacrificing your health for what you're thinking the product
Yeah.
could do for you. So I think the education is paramount. But when the education increases, we as a regulator have to be agile and responsive
Yeah.
enough. And then when we have a valid case from an investigation,
Yeah.
it gets handed over to SAPS. It gets handed over for criminal prosecution. Gets handed over to Pharmacy Council.
Yeah.
And that's where this task force you're referring to comes into action.
Yeah. So the task force, from what I'm listening, then it deals with the end part of it, means the enforcement. So something wrong has already happened, and you are trying to clamp down.
Yes.
But let's come to the beginning, and I think this is the issue that was raised earlier. Do you think there's an issue here on issues of the price of medicine, the cost of care, right? And you know that only 16% or something have medical aid, right? So it means that actually the balance of the population that don't have medical aid, this is where the cost is an issue. And that's where potentially falsified medicines can find root, because they are dealing with the fact that you can't afford this thing, you are going to die if you don't use this thing, but you don't have 70,000 a month, so I can give it to you for 5,000. It's like a machonista type of thing in a health environment. Do you think that issue is something that should be our concern? Because we can deal with the other end where things are wrong, but fail to deal with the root cause, which may be that you are creating a black market by making sure that life-saving medication is expensive.
There may be a role for cost to play, and I think really the businessman on the right of me and
the left, yeah, on the
Dr.
both
Pillay
extremes,
on
yeah.
the pricing committee can actually give more information. But as SAPRA, we don't really play a role.
You don't
in the
play a role on a
pricing.
cost.
No,
It's not
no.
your business. All right. Do you want to comment on the cost issue? Because maybe there's nothing we can do about it. I don't know. A quick comment on that?
So, JJ, our experience is that the fake counterfeit SF's compounding is not driven in the main by a product that is price excessive. It is driven more by a market that's being created where you can capitalize on those medicines. So if you look at the typical class of drugs that are being counterfeited and faked, it's largely lifestyle things,
Yes.
such as those things that increase libido, those things that cause weight loss. Even with Botox, there was an explosion. Okay?
Yeah.
Today, I'm afraid to say there are.
So it's not
even-
life-saving things.
They're not life-saving things.
Yeah.
No. And I'm even afraid to say, these days, like we used to read in these social media platforms about Botox parties.
Yeah.
There are now GLP-1 parties taking place, where people congregate and they start injecting, they're microdosing from different GLP-1 products. And those are usually from illicit sources. So it's usually driven by lifestyle drugs that are going to either enhance
So
aesthetic
does
or
it mean that the
whatever.
education must then focus on that, to say that don't take a shortcut to try and solve your problems, lifestyle problems like weight or impotence or whatever it is that
Absolutely.
people are scared about, And they don't want to go to a doctor to say, I'm not okay in this regard. Then they go to internet because the internet says, you're going to be a stallion in bed if you take this now.
Yeah, well,
Is that not the problem here?
I don't know. I saw an advert. Advert about a tiger.
A tiger, yeah.
So, but you're quite right, because you can unwittingly, as the public, take these products. And as I said, one of three things can happen. Either the product doesn't have the active ingredient it's claiming to have, okay?
Sure.
Or it can be a contaminated product. And Tumi and Tammy can tell you, there are times where you find a solvent in a product. Okay, and solvents can kill you, right? Okay, or even worse, it's a completely different product that has a completely different pharmacological action for what you're actually treating the patient or for what the patient's taking it for. So there are a cluster of problems here. So the education, and I'm very pleased Tammy alluded to this earlier.
Yeah.
We don't need a 3-day campaign, as you said, JJ.
Yes.
This has to be an ongoing,
continuous,
unrelenting campaign
unrelenting,
until we defeat the scourge of counterfeit and
You think private sector and government are putting enough resources into this? Because these things are expensive. To be out there on radio, TV, after a while they say, no, but you were here last week. Unless you pay, please don't come, don't approach us. Even the SABC will tell you that. When they are actually supposed to be as a mandate. SABC Education is supposed to have this without us even provoking them.
Look, we're obviously not, and it's an expensive exercise.
It is.
And I think we're going to have to sit down jointly, private and public sector, and see what we can do around this.
Yeah.
Because there's only so many times you can approach JJ on a pro bono basis,
Or
right?
free, to say, come and talk for free. No.
So we do need to sit down, but the part that is our first, in every war, and I see this as a war, and I'm not exaggerating it. In every war, you want to defeat the enemy. Your front line is the most important thing. If your front line holds. Now, who's the front line here? The front line is the pharmacists, the pharmacy assistants, the general practitioners, and other healthcare professionals. So if they are holding that front line, it's a very, very
It means they must be
important
mobilized.
element. Correct.
We must have a sense of health activism. All right, let's hear some comments from the floor to the panel. I'm going to take few comments here, and then I'll get the panel to give me their parting shots before we get into the groups. Any comments? All right. Pontle, help me. To those who are raising their hands, please be brief and to the point. Please stand up and introduce yourself.
My question is, what I would like to see is a more proactive response to signals, and I include global signals. And when we talk about GLP, we all knew the GLPs were going to be like this. And therefore, one would have wished that going forward, when we know these signals, when we see these signals, and it's not only GLP, many, many signals, how do we proactively react and prepare the ground before it hits South Africa, before it hits our continent?
All right, can I just ask the panel that you just make notes? I'll come so you can pick the questions that you would like to answer. Anybody else? It's a dialogue, people. It's not a TV show, eh? So it means you can talk. Anybody here?
Good morning still. Okay. Good morning. My name is Nomti. I'm from the South African Medical Technology Industry Association. Panel, thank you so much for your insightful information. I think from my end, I'm also just talking as an ordinary person from the streets. Majority of the clinics and hospitals provide medication in plastic bags with compositions and don't have sufficient leaflets that create an awareness to the person taking the medication. How does the action plan make room to accommodate this and actually provide the education needed to be able to empower people to know what's falsified and what's not? Thank you.
Very, very important. Very, very important. Anybody here? Okay, please help me there, Buntle.
Sorry about that.
No, thank you very much to the panel for insightful discussion on the topic. I think some of the questions that I had has been covered, especially by Dr. Eben Pillay. I was about to ask in terms of how will the single purchaser of the NHI will play a role in addressing this concern of substandard and falsified products. But I think he has presented it very well that it is part of the solution. I think my question will be on this. I think it's a common consensus amongst all of us that there's under-reporting in terms of substandards and falsified, and that there's no public awareness. In terms of under-reporting, what measures can be done so that we can improve reporting of such cases for the benefit of the public? Thank you.
Okay. Okay, I've got one more.
Morning, everyone. My name is Preeta. Another issue to address would also be out-of-stock situations within the public sector as well as private sectors, where the public is actually going to find these things, or I don't even know where they're finding it, of the falsified medication. But if something's out of stock, or to also try and address that situation to avoid people having to go look for it elsewhere, and the dangers that come with that.
So you must have enough stock. Is that what you're saying? Sometimes, I see, so they don't manufacture enough, so people go looking for them on the internet.
Ingredients are out of stock, or just certain brands are out of stock, and they're looking for it elsewhere. That's where they go look online or find it through other than your normal chain of pharmacies.
Right, okay. Thank you very much. Yes? Okay, Buntle? Yes, okay, I'll come there. You'll be next. The mic is not working, eh? Let's sort that out. All right, while they're busy with the mic.
Thank you for the emphasis on the word crime, because it is crime. My question is to Dr. Stavro. I don't know if I said it correct. I want to ask what mechanisms exist to prevent collusion in the pharmaceutical supply chain? Because is there a possibility that the big pharma are part of this collusion? Because if there's, if we're going to speak about the single price, the single exit price, and maybe the consequences of it, and low margins, does big pharma play a role?
Good day. My name is Alfred Khasi. I'm a SAPRA board member. Thanks for these very, insightful discussions around falsified medicine. One issue that is often overlooked but related to falsified medicines is falsified veterinary medicines. They play a very big role because these medicines, and it was mentioned also antimicrobial resistance, they are also used in animals, particularly food-producing animals. And they find their way into the human chain, into the food chain. So I think it's important that when we have these conversations, we also include the concept of One Health. And should we not be talking about it today when we talk about falsified medicines and say, within the One Health framework, how do we accommodate that? So that the One Health issue of the environment, the animals, and people are combined. Thank you.
Thank you very much. There was a hand somewhere here. All right.
Maybe you don't add enough. And if I blow a whistle
Okay, thank you very much. I'm going to take one more and then we go back to the panel.
Yeah, thank you, Mr. Chair. Good morning. Lebogang Kweitiwi from Botswana, Pomra. Just a quick one to Stavros Industry. Mine is to find out, I mean, we've had the panel, but mine is, what is the responsibility of industry to ensuring that SNF products are not proliferated? Not from a singular entity, but as industry. What is our responsibility there? And the other one is, how do you intend to align to the National Action Plan against SFs? Because already we've got the plan here. What is the industry's plan to ensure that the efforts of the regulators actually bears fruit? Because more often we know that when it comes to SFs especially, it is the regulatory authorities that are pushing and fighting, and it always feels like industry is always going to be protecting its own products, but not looking at the whole ecosystem at large. So if you could help us with that, that'd be great. Thanks.
Okay. Thank you very much for your input from the floor. Now let's get the panel to give me your parting shots ahead of our group work now. Your parting shot will start. Just take 2 minutes on your parting shot. You can also pick up on some of what the audience have said, and if any question was directed at you, you can answer.
No, I think on the issue of the medicines that are packed in the plastic bags, there's a need for us to move towards patient-ready packs that comes from the manufacturers. So that's very important that we work, I think, from SAPRA and all of us to make sure that we reduce those. The other issue is, and I agree with Stavros, is where there is a delinquent, we need to move quickly to close such and make an example, because it doesn't matter.
At the moment, that's
to
not
talk.
happening.
And I think that's what I was just thinking to say. When we leave this room, how do you make sure that this pharmacy, that's named, we tackle
It's sorted out.
Yeah, not only ourselves as SAPRA and SAPC, but the police.
Yeah.
So that we get to close the shop where people are doing misdemeanors. And I think that would be very important that we work as a group towards that. And maybe also agree that we need to go to the community stations and speak more, not only just on the national, so that we get closer to these people who are buying this falsified. So it would be very important that I think as regulators we are in that space and communicating.
Absolutely, thank you. A round of applause for our panelists. Thank you. Your parting shot, Daddy.
Thank you very much. I think for me, I noted 2 questions that I think I might have a response
to you.
for. Yes. So one is from the board member of SAPRA to do with falsified vet products. And I think I agree. There are products that are meant for veterinary use, but somehow they can also be used maybe off-label by humans, and I think this is an area that we have to look at. I'm not sure whether the national plan also is looking at veterinary medicines. If yes, I think this would have addressed the issue. The other thing was to do with how to respond to signal, I think. And so that once a problem is, when you have a problem, let's say in a neighboring country, what do you do here in South Africa so that you are prepared to fight against that problem if it comes to you, or prevent it from coming to South Africa. I think this is something that the national plan is addressing. I think one of the 3 pillars is prevention, detection, and response. I think this addresses, and I hope strategies are being put forward to address those issues. Thank you.
Okay, round of applause. Your parting shot, as Daphne.
I've got plenty, but I'll just... So, this long journey have shown us, along the way we learned, we had to see who we haven't included, who are we including, And agriculture is part of this platform, and VET is also represented, be rest assured. So we want to leave no one behind in this, because we as, I'll speak as a food soldier because this is very close to my heart. And I'm very glad that principals are in here who are very influential, who will help us to really implement this, because this depends on the release of the officials to attend the committee meetings. So when we are inviting for steering committee meetings, when we are inviting for technical working group meetings, and because education and awareness is coming a lot, and we have even, when we were doing operational plans, we even costed, we costed them how much those activities will cost, and what are the low-hanging fruits, for example. So really, we have considered a whole lot of things that are mentioned here. Mama Ndisa, you mentioning about the signals. So yeah, this also, it's also challenging us also, as well as a regulator, to say that because remember from enforcement, I'm from market surveillance and enforcement. My team, we've got a whole lot of online things that we need to be looking into and all that, whereby we are limited by capacity because the regulator only can, remember we are a government entity. In terms of employment, we always saying to the CRO and the CEO, we need more people. We need to be at professional and even at local levels. However, we know resources are limited, but as a collective, how can we really work together at the levels where you are to ensure that we, education and awareness filters to the to those ones that are even far, Mr. Tlala like to say, for example, at Kakamas, how do you make sure that those are also reached? So we are ready to implement the NEP, and the NEP is very, has got very broad activities, but refined to prioritized activities. So we are really begging all the key stakeholders that are here to say, please support us with the resources. It needs investment. Investment is not just only financial investment, but where your legislation enables you. Let's collaborate, let's educate each other, but let's do that at the lowest level as possible as well, to ensure that this is embraced by everyone. So, and I mean it, we are committed, we are here to serve. So our leaders support us in this. Thank you.
All right, please give us definitely a round of applause. Very passionate, and thank you for your leadership on this. Was definitely to get us to this point. Tapile?
Thanks. Yeah, I agree that out of stocks in the public sector and private sector cause a problem because patients then seek alternatives, and those alternatives may
what you were mentioning, the out of stock in the pharmacies.
In the pharmacies, both public and private, then lead patients to seek some other product or another brand.
Yeah.
And the opportunities.
Does that talk about poor warehousing, do you think?
Oh, well, it's a multiple, I mean, it's a range of factors. It's at manufacturer level, it's at warehousing level, it's at the pharmacy level where they haven't ordered the stock, etc. I think the second issue which was raised was there's a lack of reporting. But remember, this is a complicated issue. So somebody who buys a substandard product doesn't know it's substandard. The only reason they may suspect it is if they have an adverse event. If it doesn't give them an effect, if you're taking a hypertensive tablet, you don't know that it's substandard, right? Because unless you're checking your pressure to see whether it came down, right? So we need to educate the public to understand that some of them may be substandard, but you may not realize it. So you need to make sure that you buy it from the right source.
Sure.
I think that the third issue is also to appreciate that substandard can come from a registered manufacturer, where the quality assurance division of a manufacturer releases a product where it's substandard because the management said release the stock. I don't know if Ms. Hela can remember when she was still at MCC. We had reports of companies where stock was being released, and it's only because whistleblowing at the level of quality assurance reported to us that, well, we had to release the stock because they said we must, but it didn't have the quantity of active ingredient required.
Yeah.
So I think that also is something we must bear in mind. So it can be a registered manufacturer. And then finally, I think it's important that we...
Sorry, without interrupting, there was a question there about who deals with the whistleblowing. Is that now, these two things are linked?
Yes.
Because if there's a, 30,000, I think there was a number like that, of whistleblowing, is there what you call a concomitant capacity to deal with each of those complaints, to go to the source and actually stop it at source? Or this whistleblowing just tells us what the crisis is, but in fact you can't actually deal with each and every complaint?
Well, a whistleblowing at a manufacturer level, for example, at quality assurance, will go to SAPRA. And SAPRA has the legal mandate to then go and inspect and deal with that.
Each and every complaint?
Yeah, they do. And in this case, there was a legitimate issue, right? So it isn't as if staff simply just report for nothing. I think there are sometimes problems. So I think the final issue is about education, particularly when we talk about scheduled medicine. So a medicine where you need a prescription to access it. Now, because the doctor wouldn't give you a prescription because you don't need it, you then go and access it through alternative routes. Here I'm thinking
Which
of...
is what?
Like, for example, say a skin lightening cream,
Oh,
which is something that you would go to a flea market and you'll see a guy having the tubes there. And you're asking, where did you get this from, right?
Yeah.
So this happens in different ways, and we need to educate the public that if a doctor didn't give you a prescription, you shouldn't be asking for that, because there's a good reason why you're not getting it. It'll cause harm to you by just using that cream all the time. Yeah? Thanks.
Okay. Round of applause, please. That was really good. Very, very good. I'm sure you are pleased with what you are getting as WHO from what looks like South Africa is ready for action to make this thing go live.
Yeah, thank you. I'm truly very, very happy to see, and of course, to hear the comments from the audience, but also these panelists here. I think is very encouraging to hear all these very strong messages and commitments that all the stakeholders, as identified in the National Action Plan, are ready to work together to combat substandard and falsified medical products. Before I give you my 2 or 3 last comments, also very much linked to your very first question, which I decided not to be very specific for the reasons that I don't want to preempt the panel discussion. I think the discussion here on underreporting is critical. It's not only here, but also it's actually a global problem, and she can testify from the member state mechanism where she sits. Underreporting has been a major challenge, and I'm hoping that out of this launch, and also with the public education that will follow after the launch, the reporting from the public will actually enhance, and then SAPRA will take that up and for further actions, including reporting to the global monitoring and surveillance system. The second comment I wanted to make with regards to the questions that were posed here is on the One Health approach. Just wanted to confirm that even at the global level, we actually have a full-fledged department. It used to be a division, and now a department following restructuring, which sits in our own division now. And this is on antimicrobial resistance, and they are actually coordinating One Health approach together with the global animal health and FAO. So bringing all the stakeholders together. So we UNEP as well. UNEP, the Quarter. And UNEP, yes, on UN Agency on Environment. So all these are actually, and thank you, WR, for reminding me. So we are coordinating one approach to contain antimicrobial resistance. And actually, this department works very closely with our department because combating because SF products also contribute to a progression of antimicrobial resistance, and therefore a coordinated approach, One Health approach, is something that we are strongly actually calling for, and I'm very happy that this is also being raised at the national level here. I just wanted to finish my intervention by I'm very happy, as rightly said, and just want to give you 3 quick comments on each of those elements. I think the very first one
on prevention. This is where we should invest all our resources. Because when we prevent, then we don't need to detect. We also do not need to respond. If there's no SF, if there's no substandard or falsified medical product, you don't need to detect anything there. So I think the greatest resource and effort should be directed to prevention, including supporting SAPRA to be a strong, well-established and integrated regulatory agency in the country for both medicines and vaccines, but also medical devices, including IVDs in the future. And they are very close. As you know, they are already mature level 3 for vaccines regulation. And South Africa is the only country where we have a vaccine testing capacity on the continent that is in accordance with international standards. And they are due for benchmarking for medicines regulation before the end of the year. And I'm sure they will also be ML3, mature level 3 for medicines regulation on the continent next to Egypt. And that also goes with some elements of detection. Because I think there has been a lot of talk here, but I think I just wanted to point out that apart from enforcement and inspection and sampling that we had here from the inspectors, and so SAPRA also need to be fully capacitated with capacity to actually use some technologies for screening and also testing. I know there's a long-term plan to have their own lab, but I know that in South Africa there are also quite a few labs that meet international standards that are WHO qualified, that are used for testing products on the market, be it substandard or falsified, as part of the market surveillance and control mechanism or function that SAPRA is actually implementing. So my call to all the stakeholders is that support SAPRA to have this their own lab, because this is also important for them to quickly respond. I just give you an example here. When we had the incidents in the Gambia, we were not able to test these products on this continent. Actually, we had to ship, we had to look for labs across the globe, and we had to send these labs, samples to some labs in Switzerland. That's where the final confirmatory tests were taken, because before you go public and take regulatory actions, you must have concrete evidence that this product is actually substandard or falsified. And that can only be confirmed through lab analysis in a lab that meets international standards. So that is also critical, I think, for us to actually take this action. And lastly, on response, when it is confirmed that the product is actually substandard or falsified, we are expecting that the regulator will be supported by all the stakeholders for them to immediately issue an alert. And then that also goes with taking the necessary regulatory action, including withdrawal of the product from the market. That needs the support from all the stakeholders, from the patients, from the wholesalers, retailers, but also those who, if it's an imported product, the wholesalers in that case. So those actions are critical, and I hope that with SAPRA, on their journey to become ML3 for medicines, to complement the vaccines, then they will be able to have all the three pillars in place. But as I said at the beginning, major investment on prevention. Thank you.
Thank you. A round of applause for our colleague from the World Health Organization. And thank you for trusting South Africa to pilot this. And I hope that we won't let you down. Your parting shot, please.
Thank you very much. I think one would be to reiterate the fact that because when we were developing this NEP, we were piloting the existing handbook by WHO, which really does anchor on the One Health, the whole of government and whole of society frameworks that we used to develop this. It's one of the things that we considered, especially in a stakeholder mapping. So we know that we've got all the various key stakeholders for us there to address not only the issues of SF, but also to be able to curb the antimicrobial resistance as well. So it is a plan that provides a coordinated framework across all the PDR, as we said, prevention, detection, and response. And I do want to agree with Mr. Hiti that really prevention is one of the core that we need to do. We know we do say prevention is better than cure, and even in this instance will be better than detection and response because of the resources that we require for that. So it is a national framework for collective accountability as well that we're going to use. So really the measure of our success will not only lie on this launch, but it's going to be on that consistent implementation, ensuring that, as we said, we create that awareness and education in the public, because with prevention, an informed public and both the communities, both the healthcare providers, the practitioners, the pharmacies, if everybody understand the fact that we are in a crisis in this situation, and it requires each and every one of us to put our hands on deck and ensure that even that reporting that we are struggling with, once I am informed in terms of what the situation is and how I can go about reporting, I think that would be one of the critical ways that will be successful in here, but also expanding our platforms to ensure that indeed they are available for everyone, every man, even Gogo Dlamini, somewhere in the villages of Northwest, should be able to know how to then be able to
You think lack of education is the biggest
suspect
prevention
it
gap?
it's part of ensuring that we strengthen our prevention if we are aware, because once I'm aware, then I won't utilize what is not supposed to be utilized. When I identify it, I would know to first and foremost call out the one that has it and be able to can even elevate it later on. So prevention will rely on even people being aware and actually educated and empowered to be able to can take ownership of that which will improve their health outcomes as well.
Thank you so much. Round of applause, please, for our panelists. Your parting shot, please.
Thank you very much. So I think maybe to Ms. Hella's question, definitely we need to be proactive, and I think GLP maybe we should have as an industry in totality. I want to challenge pharmaceutical companies in the room, production pharmacists, responsible pharmacists. When the diethylene glycol situation came out, it was an opportunity to be proactive and go back into your manufacturing facilities and assess your production, assess your QA. So I want to challenge pharmaceutical companies to go back and look at their sampling methods and whatever it is that they need to do to protect substandard medicine out on the market, to Dr. Pillai's point. The next point, just on the underreporting that the gentleman asked on this table, SAPRA is launching a number of webinars and related to pharmacovigilance. We also plan to do it in other languages to help with the education and awareness. Out of stock is a pain point. SAPRA is also planning to launch the traceability guideline within the next month, and hopefully that can then assist applicants to use data coming from traceability, but also it will support the substandard and falsified market, because then you would be able to detect genuine products in the market. Dr. Khasi mentioned vet and antimicrobials. There is a task team on that together with the Department of Agriculture, SAPRA, and the Department of Health to work on AMR and as well as deal with the veterinary space. Just my parting shot is we talk about the patients as a third person. We should not let the scourge of substandard and falsified extend to such a point that the patient then becomes someone in your home, or you become that patient, or your child becomes the patient. So we all have that responsibility. Thank you.
Thank you very much. Round of applause. Stavros, you got the last word.
Thank you. So I'm going to give my parting shot up front, and then I'm going to respond to some of there were many common thematics, I think, that arose from the various questions and comments. So my parting shot first is, we've said that this is a new scourge of society. We've got a terrible habit in our country of seeming to reward criminals. We glorify them, okay? And they walk around with Gucci's and all the rest of it, okay?
Lamborghinis.
And it's seen to be the in thing. It's the most despicable behavior imaginable. It's terrible waking up this morning and you see the SIU report on Tembisa Hospital. Okay. So what is the point I'm trying to make? The point here is we need to bring some of these culprits to book urgently, because that is the big deterrent. That's the only time you start deglorifying the Gucci and all of that, right? I hope there are no Gucci representatives in the room. But
No, we didn't accept the RSVPs.
okay, good. That was very insightful of you, JJ. So the point is, we've got to make 2 or 3 high-level examples, whether it's around a counterfeit, a fake, or even this compounding scourge now that we're talking about. United States has banned compounding of GLP-1s. Can't do it. Okay. Now, let me cover a couple of the questions that arose. And many of the questions led to some very pragmatic questions we need to introspect on. And, as we begin to roll out the program, understanding this is an action plan, it needs to become resourced and capacitated. And that's kind of the next step we're looking forward to as industry. But some of the things we ought to do urgently. We need greater regulatory, I think the right word is rigor, okay, because the regulations exist in the law, but the perpetrators are manipulating the law in a particular way to give some form of credibility to what they're doing. So as we embark on this, we need to be more rigorous around how the law gets interpreted in the first instance, and then how it gets applied in the second instance. Okay. I am concerned that our country doesn't have sufficient prosecutional capacity, but that is something we need to address, in a task force. If a task force is created, I think that's something we need to. And I think you'll find a willing partner and participant in industry trying to assist. South African business, through Business for South Africa, is in a formal partnership with the presidency. And one of the 3, well, it's now 4 priority areas. So the 4 were logistics, supply chain, energy security, safety, security, and corruption. I think we need to bring this in under that 3rd element. I'll discuss it with Tumi, because it does exist, and what we're trying to build up there is prosecutional capacity in the country.
There could be special costs to deal with this kind of thing.
Correct.
Yeah.
Correct, yeah. But also the prosecutional capabilities, because, I'm in the mode of naming and shaming. They're notorious criminals that it's an obvious case that they should be sentenced. It's obvious. It's a slam dunk, as they call it. And they're roaming the streets of Johannesburg today. Why? They go and secure the best counsel. And best counsel gets them off on a technicality. Okay. And there are many examples, JJ, that you know. Okay, so we can't allow that in this instance either. Okay. Now let me address Mandisa's question around the signals. I think very important. We should have known this was coming as a country. It was dead obvious. A weight loss drug that's that effective, or weight loss drugs that are that effective, there's going to be a proliferation. We should have buttressed up our enforcement capacity a lot better. Not that the rest of the world's done exceptionally well around this, they haven't. But charity always starts at home, I believe. Okay, the question around, is the industry or big pharma, I think the lady said, in collusion? Okay, I'm not sure why there would be collusion around undermining your own products here. But if there's any form of collusion, I think we've got an exceptional competition commission and a tribunal. I think we've got amongst the most progressive and widely acclaimed competition law in our country. And I think if there are ever any concerns around anti-competitive or restrictive behavior, I think the Competition Commission is very effective at dealing with these, including in my own sector. There have been many examples where they've weighed in. But in this instance, it wouldn't make sense for Big Pharma to collude on a falsified or substandard medicine, because they'd be damaging their own market shares, which is not that they want to do. But seeing that the colleague did raise competition issues, I think another area we've got to watch very carefully here is counterfeits undermine intellectual property rights. And intellectual property rights are important for investors. So if investors get a sense that a country is not protecting their IP, then they don't bring the IP into the country. And that is what SF products are doing. They're undermining intellectual property. They're costing you and I, the taxpayer, money, but they're also chasing away investment. And we can't allow that. Now, the very last comment was from our colleague from Botswana. The most obvious thing that industry has done is to double down on track and trace capability. And track and trace can be incredibly effective, but it's what happens when you find an ineffective product. That's where the enforcement agencies need to come in. And they haven't come in so far. To be perfectly blunt, they haven't. And that's why we need a task force, so that you start aggregating all this information. These are very often very sophisticated criminal syndicates that need to be dealt with, and you can't deal with them superficially. I mean, SAPRA would never have the capacity to do this. This is a matter for SAPS, it's a matter for customs, and SAPS and customs have been at the periphery, unfortunately, of this conversation and need to be brought front and center. Okay. And then I just want to make a comment on, on the stockouts. That's another important thing. Supply chains, pharmaceutical supply chains have become incredibly complex. And out of stocks are usually driven by two things. Either an incredible demand for product, like we are seeing with GLP-1s, or alternatively, shortages of active ingredients or other excipients. I'm not saying it's the only two reasons, but those are the two main reasons. And it is true that when you do experience shortages, then potentially we can be driving patients towards SF sources. And that was the caution Dr. Pillay was giving. So we do need, I think, more flexibility around some of the provisions that exist in law that enable us to import registered product from elsewhere into our country. We need to have that debate, and we are having that debate separate at the moment. But that is a very important element to managing this whole thing, because I can see with a lot of these compounded pharmacies, they're phoning in and they're saying, well, the patients can't get the real deal, so we're having to now compound it for them. So we're exacerbating a problem in a sense. Yeah. Thanks very much.
Okay, round of applause to Dr. Stavros. All right, thank you. Can we also give a round of applause to all the panelists for their contribution? And you are released to go back to your tables. All right, we're going to, sorry, apparently they want to take a group photo. I never understand the group photo thing, but I have to comply, you know. Please stand there. Dr. Stavros? Yes. A quick group photo. All right, thank you. Round of applause, please. All right, now, we are now at the point of group work, right? Please don't leave at this point, right? If you want to go and grab a cup of coffee, quickly, there's going to be 5 minutes, but before you go, right? So every table, right? I don't know, is Dr. Mohammed here? Yeah, so Dr. Mohammed, you are the leader of your table, right? Every table must identify who is the table host. Table host, please take out a blank piece of paper and write down the 3 ideas that are going to come from your desk. My team is going to come and collect that piece of paper, right? Once you have spoken, I'm going to come to you quickly and say, tell us what you are discussing in your, remember, sorry, please listen. Shh. Sorry, please listen because you're not going to understand. Right, Dr. Stavros, where is he? He left. He already gave a bad example. Because I said one, and he says, no, I want three. I don't want that. You give me one actionable, right? Under prevention, under detection, under response. The one thing that your group is agreeing on. Because if I calculate those 3 times 20 tables, it's going to be a lot of stuff. And that's part of trying to get, actionables from here, right? There's already a plan, yes, but you are now coming in as stakeholder to say, we think this is the most important, or this is what needs to be prioritized, okay? So, number one, identify who's your table host. Some of the table hosts knows themselves, they can tell you. Otherwise, just choose somebody. That host must write down what you are discussing. And then in 30 minutes, literally, I'm coming to you to say, what is your one thing in this table? What is your one thing in that table? Okay, you've got 30 minutes to discuss as a group. Then we wrap up the launch. We wrap up the dialogue.
I was in CCM now.
We grab some coffee.
MC.
Are you happy?
I love it. I love it, and I like, I like the discussions that are being, or the issues from the ground, because this is what people should understand. This is a framework.
Yeah.
It's a global framework.
Yeah.
And the issues that they are raising, it's important that this framework addresses them.
Addresses them.
So I think the mentality that it's your responsibility.
Yeah.
If we're saying, even what we're talking about, for example, enforcement and so forth. Of course, enforcement is good, but you as manufacturers also have a role to play. Where are you seeing yourself in this?
Yeah.
About enforcement, no. We don't have to only be policing.
Absolutely.
Set up systems so that we don't have this kind of issue. I like the issues that were coming up now, and then how do we make sure that the framework contains those, the AMR issues, the One Health issues, the public awareness, the prevention. So that's now the activities. That's a framework plan, and of course there will be action items. So that's
brilliant.
Everybody should actually look at what's coming up.
Yeah.
And then of course the issue of pricing. I think it's a very important discussion.
It is very
So what
important.
should have also come out of the issue about how are we financing the health sector? The domestic resources, and so it's a very important topic in terms of the drugs, making sure that they're affordable. So NHI does have a role in this.
Absolutely. I was about to say there's a link to NHI on this.
So maybe issues of access, the quality, and also that there's no financial hardship. So that's what people also end up going for falsified medicine.
Yes, because they just can't afford the real stuff.
Yeah. So how do we finance the health sector to make sure that we are also addressing this conflict? Because these are side effects from a sector that's not. So the issue of domestic financing, alternative financing, the NHI, the reforms in the health sector.
No, I'm confident something good will gonna come out. A key thing is how do you roll out the campaign for the next 12 months? Make sure we don't lose momentum. Because the government launches all sorts of so many things. Absolutely.
Great work, my dear. Great work.
This is good.
Yeah, I love it.
I think it's really done very professionally.
I love it.
You are the best.
But by the way, I want to say something.
I'm told that you are just quite expensive, but you are the best.
I'm not expensive. I just go to those who can afford me.
So affordability.
Yeah.
Affordable.
By the way, before I
It's not a joke. It's not a joke. So somebody from the draft authority said to me, I've got 15,000 rand. How much can you do a dialogue? I've got 400,000. He says, so off the month. We have to talk later.
Yeah, we have to negotiate now because there's no money. Even the US, like,
I know.
Yeah. Money's finished.
But don't you have money for the actual campaign? Because we need to get the private sector to fund. Ladies and gentlemen, please settle down. May I have your attention, please? May I have your attention, please? I want to welcome the MEC of Health in Gauteng, MEC Nkomo Ralehoko, who is going to talk to us and greet you and say a few words, MEC, before we get into our next session. MEC, please give a round of applause and welcome her to the stage.
And you know, I'm always scared of talking because I've been. Thank you, Program Director, and let me start by really apologizing to everyone. I know Program Director was supposed to come and introduce my minister. I'm sure he told you where he's going after that. That's why he has disappeared. Because we're trying to make good of his eyes so that he can see. So let me greet him in his absence, Dr. Aaron Mtswaledi, our minister, all representatives from the South African Health Products Regulatory Authority, panelists from various government departments and organs of state, distinguished guests, ladies and gentlemen. Prof, let me first apologize for really arriving late. It's unprofessional, I know. In the program, as I was supposed to introduce the minister, but because I had to start at the Gauteng Provincial Legislature, today I was answering, I think, about 6 questions, and I've still left my colleagues, they're still on answering their own bit of questions. And I'm the leader of government business, so I'm more of a whip of all the MECs. So I have to make sure that all of them, they answer these questions, and they must answer properly, because it's not just about ticking the box. It's about the service that they must render to the communities, including myself. And as you know that it's very difficult to postpone those engagements. So I sincerely appreciate your understanding and your patience to allow me, even if it's few minutes, to speak to yourselves. To all the distinguished guests, stakeholders, panelists, and everyone present, it is truly a privilege to be part of this important event. Even if I could not arrive at the time when it starts, it is indeed an honor to join you. And I'm pleased to be part of this important gathering. The presence of so many stakeholders, the experts, partners, demonstrate the seriousness with which we will take all these issues that are here, we're discussing here at hand. It is because of this shared responsibility that we must now confront, which is a challenge that affects all of us every day, the serious threat posed by substandard and falsified medical products. The reality is that substandard and falsified medical products are a serious and growing challenge in South Africa. Here in Gauteng, with its dense population and busy healthcare system, the impact is very significant. Patients who take these products often see little improvement, and in some cases, their health worsens. This puts a heavy burden in our hospitals, in our clinics, where staff work tirelessly to care for patients who arrive in a very critical condition in the hospitals and in the clinics. These dangerous products are also shaking public confidence in our healthcare system and can even contribute to the spread of diseases. Tackling this problem is not optional. It is essential for protecting both health of our people and their trust in our institutions. And I'm happy with the relationship that we have with the WHO. We are going to deal with this problem head on, as we have been working together in dealing with some of the issues. But this one, for me, it must be on top of our agenda, as we'll be meeting soon, immediately after this meeting. Every day, real lives are affected by medicines that don't meet quality standards. Children, the elderly, and those living with chronic illness are particularly vulnerable. Beyond the human cost, financial impact on families and the healthcare system is enormous. Patients often need additional treatment, repeat visits, and longer hospital stays, substandard and falsified products can also contribute to antimicrobial resistance, a threat that affects all of us. This action plan then gives us a clear and a structured way to respond. It strengthens regulations, improves detection, and coordinates rapid responses. Using this guide means protecting patients while purporting a stronger, more reliable healthcare system for everyone. It is for these reasons that then we gather here today. This launch then is a concrete step towards addressing the real threat in the public health. The guide lays out clear steps to prevent harmful medical products from reaching patients, detect them quickly, and respond effectively when they are found. It also helps government departments and agencies to act with confidence and coordination, removing uncertainty and inefficiency. Importantly, this guide will standardize reporting across the province, ensuring that no cases are overlooked. It will guide the risk assessment and resource prioritization, focus attention where most is needed, and provide safe procedures and disposing confiscated products. Training for inspectors then and enforcement officers will be strengthened, ensuring everyone is equipped to handle these challenges. It will also improve data sharing and public awareness, giving citizens the knowledge to spot and report suspicious products. This effort cannot succeed on its own. It requires cooperation amongst all of us here, of multiple departments and agencies, each bringing their own expertise. Agencies such as SARS and SAPS play a very crucial role in identifying and confiscating illegal products. But in the past, there has been uncertainty about how to manage these products once seized. This guide provides then clarity and a standardized approach, ensuring that dangerous products are removed safely, efficiently, and legally. It promotes collaboration with international partners who provide critical support in tracking and tracing and managing illicit medicines. Together, these efforts will make a real difference in reducing risk posed by substandard products. Collaboration is key, as I've said, working together with those partners, government departments, National Prosecuting Authority, health professionals, and other stakeholders. We can make a tangible difference in protecting our people. Each partner brings unique expertise here, and when combined our efforts, we are stronger, we are faster, and we are more efficient. So, Program Director, no single department can solve the problem alone, but united we can prevent harmful products from reaching out to communities. This collaboration again also builds trust in the public, showing that government and its partners are vigilant and committed. Through shared responsibility and coordinated action, we can save lives and strengthen South Africa's healthcare system for generations to come. It is important then to recognize the leadership, the expertise, the commitment that is guiding this work. The success of this initiative reflects dedication of multiple government departments, regulatory authorities, health professionals who have collaborated tirelessly to protect the well-being of our people. I can see some of her, it's in front of me. And you can't leave this thing, né? You go out and come back again. Their vision, so it's an addiction to you, Mpo. Their vision coordinated efforts ensure that National Action Plan is not just a document, but a practical and actionable strategy that strengthens our healthcare system and safeguards every patient. Each step, Program Director, that we take today carries the responsibility to protect their lives and uphold trust in our healthcare system. Every decision we make, every action we implement reinforces both the integrity of our system and shared commitment to protect healthcare of every South African. The work ahead will demand focus then, colleagues, and perseverance, but the results will be seen in healthier, stronger communities and a future where preventable suffering is eliminated. Thank you, Program Director Ndiyabonga. Thank you, Enkosi, and Ndiyabulela.
All right. Give her a round of applause, please. Can we please stand? Looks like there's a need. Just stretch your hand to the person next to you. DJ, you are sleeping. Stretch your hand to say we are in the last mile. Thank you for showing up. We are in the last mile of action. All right, the DJ is asleep. Up to so far, usually with these conferences, people come and just dash after an hour, you know. So we are now in the last stretch. I'm going to appeal to you. I know we're running a little bit of late. We're supposed to end at 2. I see here it says up to 5 p.m. Please don't be scared. We'll be finished by 2:30. I know that some of you may be hungry. If you are a bit dizzy or diabetic or whatever else, there is food outside. You can go there to make sure you don't collapse. We don't want to be able to give you, what did Stavros talk about? What? Yeah, hey, no, we don't want to be injecting you or anything, insulin and so on, you know. Just eat something. But at 2:30 you'll be eating downstairs, no, across there at the dining room. Okay? So now what we're going to do, not all of you can talk, obviously. There are 20 tables. I don't think all of you will report. We're going to select 10 of the tables. Because as it happens, you know, after 10 people have reported, there's nothing new that's going to come. And I don't want you to stand up and say, I'm covered. So we're going to just do random picking of the 10 tables. The others, please, you've written down. My team is going to come and collect those reports so that your views are also taken into account. The fact that you are discussing in your tables, that's part of the dialogue. The dialogue is not only for those who can stand up and talk, but also those who can talk in their tables. So we're going to start here. Where's Dr. Mahomet? He's my first victim. Please, do you want to talk?
I knew that you were going to be the first.
Yeah, okay, please, lead us.
Well, thank you very much for the opportunity. So firstly, I must say...
please, let's listen.
There's always a political will, but sometimes there's no implementation. I hope there's implementation this time of an initiative that's a very important one, as was mentioned by all the panelists. So I think, firstly, is the political will that's important. I think education, everybody's mentioned that, and collaboration is pretty important. Getting a special task force to share information and identify at early stages impending problems. And now with AI, I think it's easier to actually foresee some of these problems in which we can overcome if we put measures in place. So there's all these things that were talked about before. Manufacturing is very important, local manufacturing, and maybe getting a tag from a manufacturer right to the consumer, I think is important. So these things can be detected early, and encouraging local manufacturing so we don't have to just get API from countries like India and China, but we can actually get products of our own. But I just want to put you through to one of the practical stuff that we came up with here was that we know there's a problem at the moment of counterfeit medicines. One of the things we thought about is industry. There was talks about private-public partnerships. If industry can come together with SAPRA, because SAPRA in the end are the custodians of trying to find out what's happening, what the scale of the problem is. And if industry can maybe assist with capacity and maybe sponsor young graduates so that they have the skill set to identify these medications and go to the big hotspots. We know where the hotspots are. The hotspots are in spaza shops. The hotspots are in compounding pharmacies. The hotspots are in unregulated wholesalers. Some wholesalers, especially, I don't want to again name and shame, but some wholesalers again have lots of food in there, and these things are carefully camouflaged in this. And if we can give people the skill set to detect this, then that may be a start for big. So we think industry can partner with government to try to assist them in doing something.
You pledging that your company will do something like that?
It will be a dual thing. It will be.
All right, please give him a round of applause. And I want to once again thank you and your company for supporting the Mail and Guardian practically to make sure that they can stream this event. Actually, I got some comments from people, random people who are saying, we're watching from this country, and let's make that practical partnership. Thank you. Right? And if this table, do you want anybody wants to report? A young one. A young one. Okay, please report.
Hi.
You are standing in between people and their lunch.
Sorry for that. Good afternoon, everyone. My name is Judith Nkuna, and I'm a master's student at TUT. So here we discuss a few points, but I would like to start with the hotline. Especially when it comes to reporting substandard and falsified medicine in the, I can say, in the area. Mostly it's easy to report crime. We know it's 10,111, we know with emergency numbers, but when it comes to falsified and substandard medicine, we don't know where to report that. Not everyone has access to the website or the links where we go on, maybe, let's say, for example, SAPRA website where we can report. But with the hotline, it will be easy for everyone, especially free hotlines, especially in developing countries. Not everyone has access to internet. So another thing, again, is education. So for example, I would like to make an example with when HIV was scary back then. We used to have programs where everyone was teaching about HIV everywhere. You find pamphlets everywhere. But now when it comes to this substandard and falsified medicine, we can't have access to information because people, they lack knowledge when it comes to that. I can come and just buy a product. I'm not sure if it's genuine or if it's falsified. So we need also to raise those things where we can teach people about that. Thank you.
Thank you very much. Round of applause, please. Yeah, I think that's quite a very clear proposal there. Hotline is a hotline that's relevant the same way as 10,111, where you know 10,111, but do you know where to report substandard? I don't know, but maybe you know from the BMA. Do you know?
Yes, we know where to report. Publicly, there's information that's available on the SAPRA website, and I believe it's one website of government which when you open, you're definitely going to have...
Go to your website.
You'll be surprised, Program Director, with what you are able to access in all the social media platforms.
Okay.
Yes.
Social media, all right.
Thanks.
Good, we need a 10,111, that's clear to me. Okay, do you have somebody there to report?
Anybody this side? I think we're going to have to get our...
Just pick that table there.
Yeah.
I said they were not discussing
There's a lady over here before I got
all
my
right.
next victim.
Good day, colleagues. Nice to see you all. I am representing Brunel Laboratoria. I am the responsible pharmacist and the QPPV for the company. So I think we spoke a lot about patient education and how we should educate patients as well as our actual employees in companies on how to handle counterfeit as well as falsified and substandard medicines. So I'm not going to go into depth with regard to the actual education factor. I think a lot of people spoke up about that already. So in a response, our table said, we would like the Medicines Act to be revised to empower law enforcement agencies to prosecute the prosecutors and or implement fines as it is needed in the certain circumstances where these people are then caught. For prevention aspects, we said we must improve good governance. And then also, if I think about the industry that I am in, if we speak to the wholesalers and the distributors per se, we should, as professionals, as pharmacists, especially the responsible pharmacists sitting in these positions in companies, we should focus on continuous employee education to raise awareness on this aspect. Because it is not always said that the person next to you is aware of the actual problem that we are facing. We aren't all healthcare professionals. Not everyone in the pharma company, working in a pharma company, is an actual healthcare professional. So education internal is key. And I think also a lot of our people in the companies should attend webinars hosted by SAPRA and hosted by relevant other stakeholders in the industry. I also think wholesalers and distributors should implement stringent security measures to prevent theft as far as possible. If a company system is not robust, it may result in stock being stolen and sold on the black market for personal gain. We should also make sure that stock returned from clients are destroyed in an accredited way by an accredited waste company with a destruction certificate issued, as deemed by the Medicines Act. Otherwise, it stands the risk of ending up on the black market. So that is the input from our table. Thank you.
Thank you very much. Anyone this side? All right.
Thank you. These are the inputs from our table. Under prevention, we said that addressing the issue of affordability is a reality for most South Africans. Through educating our people at grassroots levels on the dangers of buying the cheaper option versus being able to buy the most expensive option is key, because most of our population really believe that buying from the store, down the road is, it's genuine. They don't think that there's anything wrong with that medication. So addressing affordability, the issue of affordability through educating the public is key. Under detection, it's a robust one, but we try to compress it as much as we could. Increasing capacity for post-market surveillance and detection by lobbying in big pharma who already have the infrastructure to do the testing is also important. I think there was a question that was raised earlier, what is the role of industry in all of this? Because it requires a lot of money to set up labs, but there are already existing high-tech, laboratories in this country that most pharmaceutical companies have. So harnessing, that through pooled resources is also something very important that we can consider. The last one, response to, under response, we looked at increasing the rate and the ability to respond to reporting signals. It takes very long for our regulator sometimes to respond to signals for, medication, reporting of medication that has been found to be, substandard or that has adverse effects or events, So I think if we can work on making that system of reporting more robust, that will help. Thank you.
Thank you very much.
I have a hand
All
aside.
right. Okay, go ahead, Buntle.
Okay, so for our group under prevention, we started off by, piggybacking on the whole issue of public awareness campaigns. And we know that education and awareness is critical, but I think when you talk about prevention and awareness, it also needs to, publicize high-level arrests. Because when you are talking about prevention, awareness, bring in the aspect of publicizing these arrests and ensuring that that is also tied to the effectiveness of how law enforcement is timelessly prosecuting the perpetrators. Under detection, the view was that you need to have a multi-pronged strategy. It can't be one strategy. I mean, the example was if you're thinking about people in Alex or people in the suburbs, you can't have the same strategy. So it needs to be tailor-based, and it needs to be a risk-based approach in terms of detecting. Under response, responding, improving vigilance, I think that's a common theme that's coming across, that yes, there is vigilance. We know that, for example, under SAPRA, we heard today that the ADR and product quality complaints reporting is being strengthened, but how do you then add reporting of the substandard and falsified medicines? But the view of the team was that we need to start deploying the task teams that are not only coming from SAPRA, but also including the law enforcement teams, so that it's a multi-sectoral response in terms of the task teams that go on the ground to respond to the issues. So you want the task teams to be multi-sectoral, you want them to be able to also, we kept moving towards arresting. Yeah, because we feel that there needs to be something that's gonna shake the system. So that was the view of the table. Thank you.
Thank you very much. Anyone at the back here? All right.
Good afternoon, Norm T again. I think our table had a really robust conversation as well. So what we'll probably mention is not to repeat what's already been stated, because our colleagues have been spot on, I think, in terms of the synergy in the room. So maybe one thing to mention is that we think that there should be an amnesty period that should be granted possibly to the public, where people could be able to come forward and dispose of substandard or falsified medical products, the same way they do with gun violence in the US. So maybe that could be one thing. The other idea would be possibly, and obviously I'm not a chemist or anything, but maybe putting some form of ink in substandard medical products, so that once it's gone past its expiry date, it turns black. It's just an idea, ne? So if you are blessed with the ability to do something like that, then we run obviously an awareness campaign to say, don't drink the black pill, because, but that's all from my end. Thanks.
That's a truly good idea. All right, you've...
The side?
Buntle, is there somebody there? Please try to stand up so that that camera can catch you. Otherwise, you won't appear on TV.
Oh, wow. That's important. Good afternoon, ladies and gentlemen. My name is Noktula Dube. I come from Hetro Drugs. I am here today representing table number 15.
Put the microphone closer to you.
Okay. Representing the ideas and opinions of table number 15, which is quite a diverse table with different people from different sectors. Well, under detection, the first point that we discussed was with regards to serialization. Well, for you, when the drug comes into the country, you have to be able to detect it. And definitely will know this. We're trying to move towards serialization. For those that don't know what serialization is when the manufacturing, the manufacturer, wherever it comes from, then they put something like a serial number or a QR code or whatever, that when it gets to the port of health, whichever it is, then it sort of scans. If it doesn't speak to the information that's on the database, then it sort of kicks it out, and already you know that you're dealing with a substandard, or rather a counterfeit. But onto that as well, there were issues such as unauthorized ports, because we all know that, you know, when you're bringing in substandard, or if you're bringing in counterfeit, you're not going to go through the correct procedure or the normal port. So we need more deployment of experts in those other ports, such as your Bait Bridge and your Ministerial ports of health. So we know that, ports of entry, so we know that whatever is coming through there can also be detected. So we deliberated on that point quite a bit, and the other, okay, I'm only going to touch on one, as you said, 1 point per heading. And then we moved to prevention. Prevention, it was training. I think everyone has alluded to the fact, and we also just re-emphasizing on it, that training of the police, the Home Affairs, and all the other personnel that are within the space, they need to have their scope extended so they know how to deal and how to handle the influx of counterfeits. The last point under response, just like this other table, we're more on the consequences. The ideas were to really confiscate, and those that are responsible must really, really suffer and have the name and shame and prosecute, because they have to feel, you know, the impact of what they are doing. So if we're just going to leave it at that we've detected and we've prevented, but then once we've caught you, how do we then react to it? So yeah, thank you.
Okay, thank you.
Good afternoon. My name is Matlapeng Shabalala. I come from Population Services International. Table 14, what we discussed, in terms of prevention, we spoke, 13, apologies, 13. It's looking the other way. We spoke about education behind the mountain. I think we know information gets to all of us in the suburban area, but behind the mountain, there's really no one who goes behind the mountain and go there and make sure that there is training via radios. And then what we thought, there are people that has impact behind the mountains, and then we thought of the TCN, Council for Traditional Medicines. Those are the people that can have impact in terms of reporting into behind the mountains. We also thought the local pharmacies and the healthcare workers, the rural area people can quickly go report there. In terms of detection, we spoke about the stringent supply chain management. We know that the supply chain involves a lot of things. Let's look into the ports, and let's have all relevant stakeholders be actively participating when the goods come in, so that they can be easily detected and quickly. Increase the lab testing, and also increase the inspection from the inspectorate part of things. In terms of reporting, we spoke about proper prosecution. And what we thought about here is that let's involve maybe the NPA more in terms of us being able to build a better case so that when it sits in front of the magistrate, it will not just be thrown out and say it doesn't have enough evidence, there's no much weight to it. So the involvement of the NPA into the collaboration might give us insights as to what will be the core evidence that will pin down the perpetrators into finally being put behind bars. And we also thought of that we need to name and shame, like Dr. Stravos said, let's publish the flyers of all the perpetrators and then be circulated around in the newspapers or whichever media we can use. Thank you.
Okay.
Good afternoon to the MEC, the DDG, CEO of SAPRA, and esteemed guests and speakers. My name is Tiren Mohan, and I represent table number 14. We won't overlap on what a number of the tables have said, but we will speak about a possible solution for detection in South Africa. We're looking at a national app or portal to detect the fake products that are being distributed amongst the South African population. So all pharma companies, healthcare companies could possibly contribute to the sustainability of the system, which could be run through an AI system as well as through integration of an algorithm. This system, with the use of AI, can help detect and help to prevent the utilization of these possible fake drugs. The educational system in South Africa is of paramount importance, and this would start from grassroots level all the way up through to tertiary. So over and above just education, the education of the public, we could start that fundamentally in your schools, your universities, colleges, etc. From a prevention point of view, we feel that the app and the portal system with stronger control mechanisms at the border points of entry in South Africa will provide and enhance the capabilities to detect what is coming in and what's being controlled. And I think someone did touch on it in terms of the QR system and the coding, which we also agree on. Which is very important for the data collection as well. From a response point of view, the app and portal which we are speaking about will enable the monitoring, control, evaluation, and the access to the various authorities within South Africa to ensure that we meet the SAPRA compliance perspective. SAPS has accessibility once SAPRA has notified them on the various outcomes of what has been detected, as well as the Department of Health. So in essence, there is a full control mechanism with this national portal or app on a mobile device which can be utilized for the detection of fake products that hits our market. Thank you very much.
Okay, thank you. Round of applause for that. Your table.
Good afternoon and thank you, Prof. Because this have been mentioned before, I'll really be very brief. Yes. Under detection, we said use artificial intelligence and information sharing across agencies internationally. Under response, we said drive enforcement, prosecution, make an example, and have zero tolerance. And under prevention, we said strengthen border control and ports of entry, and do that also domestically, which means across provinces. Thank you.
Wonderful. Straight into the point.
I have another hand.
Bonte, where are you?
I'm behind you. This side, to the right. Okay, now go to the left.
All right.
Good afternoon, everybody. I'm Leilani. I am a pharmacist, but I'm speaking on behalf of individuals here just as the general public, so not as a pharmacist. So the idea of education has been repeated over and over, and we agree with that fully. We do believe that the general public needs to be educated as far as possible. So in terms of availability of these products, I showed my colleagues here today how easily it is to purchase these products. It's a matter of a click to order a product and have it delivered to you within a few days. So as quick as it is to click for me to order that, I need to be able to get information to tell me that it's not safe. So the awareness of what these products can do, almost as a scare tactic, the pharmacovigilance side of things in terms of the adverse events that could happen and how these products are produced. So I know in terms of SAPs, once you do have a raid and you collect all your information in the products and you take all your photographs, if you are able to, please provide those kind of images to the public to scare them in terms of where your product is coming from, and that there's no regulations, there's no batch traceability, and there's no comebacks for you once you've purchased that product. In terms of, so that falls into prevention as well. In terms of the response, we need to enforce legislation as far as possible. In my opinion, I think we've got very good laws in South Africa to manage these situations. It's just a matter of empowering SAPs as well. So if we as individuals report these incidents to a police station or to SAPRA, what happens thereafter? So also if something is sold and one of these individuals actually sees it online, how do they identify that it's not a legitimate medicine, despite the fact that it's online, which is obviously a problem in its own. Then there's just another aspect which I think hasn't been addressed. So on a personal note, in terms of diversion of medicines, there's a lot that is removed from our wholesalers or sold out of the back of pharmacies, which are not included in this forum that we need to consider as well, because the same people that are counterfeiting or falsifying medicines are also selling some of these products, so that needs to be addressed. Then in terms of feedback, once these reports have been sent through to SAPRA, please acknowledge the people who are providing you with this information so that you can conduct these investigations, because you're going to need them for more info so that you can have an effective prosecution. So acknowledgement of people who are bringing the information forward and your whistleblowers is key. Thank you.
Okay. I think is there, we're done. All right, last one. Okay, our last report, and then I'm going to give to you, I was definitely to sum it all up for us. Oh, there's one more there, all right.
Thank you. My name is Fense Maseko. I'm from VETS, Pharmacology and Pharmacy Division, and my master's was on fake medication and prices. Wow. Firstly, we would, in table number 2, we would like to congratulate SAPRA on One Health. One Health recognizes the interconnectedness of humans and animals. So we always speak about humans and not animals. So congratulations on that report. And also for Dr. Pillay, congratulations on the AMR report work as well. And then we've noted that Dr. Mkari and Palazzi are here, and it would have been nice if they would have touched the 6 building blocks of the success of who? Yes. Who 6 building blocks for the success of the health information system? So our report, for DETECT, we spoke about forensic testing on borders, and the police already have a forensic unit division, so that would be nice if SEPs would assist there. And also we've got Stats SA. Stats SA would be very important in this discussion so that they can go house to house and inform the community. And then we spoke about the dedicated anti-counterfeit policy, because the current policy is on counterfeit, the Act of 1997, so it would be important if there is a dedicated anti-counterfeit policy and a revised SEP policy. Thank you.
Can I please have, sorry.
Yes?
Just one more, because they had been waiting and they'd hoped that you'd see them this
Yeah,
side.
okay, go ahead.
All right.
Good afternoon, everyone. I will not stand between you and going home, so we'll try to be short. My name is Educate Tuto Sebotse, and I am representative I'm representing prosecutors, industry, SANC, and SAPRA. I'd like to also say that my master's topic was also on substandard and falsified products, but it was on platforms that we can create for those low-income communities for them to reach this information.
Please share the thesis with us, and you too. All right.
Thank you, we'll connect. So on our team, we also focused on prevention, and we are aligned with what our colleagues mentioned, but we focused more on the funding component, which we realized that we need funding for education, training, and awareness programs, not only for the communities, but also for the healthcare professionals and the prosecutors, and in order to form the task teams which will deal with this specified challenge with the resources that would be pulled together by the different industries. So we have noted some of the programs as programs that will integrate the CPD programs so that they are streamlined with this kind of priorities and other national priorities, and also to ensure that the communication in the low-income areas includes billboards and radio stations in the languages that the community people are speaking. And also to ensure that the programs are clear with very clear timeframes as well as clear outcomes. Thank you.
Thank you very much. There was one, is it? It's you. You are the last person. Okay.
Thank you, Chair. Unlike the two previous speakers, my master's was not on fake medicines. And but I work in regulation of medical products, so I know a thing or two. I'll be very brief and straight to the point, and I'll only mention those that have not been covered. Yeah, so the first one that we had under prevention is cross-border collaboration to prevent proliferation. The second one we have under detection is to conduct regular and random testing of samples. This also goes hand in hand with supporting or strengthening lab systems for SAPRA. And the last one that was not covered, the most important one that I think came out of this group is to develop some sort of a technology, like an app, that will be helping the end users to detect substandard and falsified medicine. And this can also go all the way up to the regulators themselves to be able to detect. The last one under response is to strengthening collaboration amongst key players in the country, BMA, SARS, and all the others that have been mentioned. And last one is to have a rapid alert system in the country. Thank you.
All right. Can I ask Stephanie, please come to the podium here and give us a summary of the day. And then after that, I'm going to ask, there are a number of stakeholders who are here, from SAPS to BMA to, we're going to just please agree amongst yourselves who's going to speak. I'm going to give you 2 minutes each to give us a message of support. Right? There is a big watch here. It will count you down. Yeah? It will give you, it is 2 minutes, and it starts counting you down to give us. You can talk as long as the 2 minutes. All right? But Stephanie, over to you. You've heard what the people had to say. You've heard what the tables have had to say, the suggestions that came out in terms of prevention, in terms of a range of suggestions that you may or may not have heard of them before. But now that we have come to this point, we have launched this plan. Give us a sum up of the day from your perspective as SAPRA. Thank you.
Oh, sorry.
Announce the notes.
Thank you. Where do I start? Please pardon me, I don't know protocol, I'm not at that level. But I would like to really thank the ministry, the department, and we are in Gauteng, the MEC of Gauteng, and I would like to, this is the one that I wanted to start with, but because of protocol, I want to thank my CEO. I call her my CEO because she enabled this. I want to thank you, the CRO, because you enabled this. I want to thank the SAPRA board, because without them, this would not have started. This journey started in 2021. WHO was hosting an Afro-region stakeholder workshop in Johannesburg in 2021, and they mentioned that they will be conducting this pilot. And I was there with Mankambule, who has subsequently left. I was there with Dion, who can please stand up. And we at that point, we expressed interest, and we said we're going to take it back to our organization. So thank you, CEO and the SAPRA board, for allowing us and the department to, when WHO presented this, you welcomed it with both hands. And we want to also thank WHO, the country office, the headquarters, for all that you have done for us. I mean, Mr. Hiti Silo, Rutendo, Gloria, Dr. Magombo, Mr. Magoro. I mean, this long journey that we have walked together, stepping on each other's toes regularly, but knowing that where we are going is more important than where we currently are at. So where protocols have been not observed, we are asking for apology, but today speaks for itself. So we've got Global Connecting Online, we've got Afro-Region on SFs Connecting Online, we've got our SADC, some of our SADC members are sitting in this room, some are online. Auda, thank you so much. And then we have got various stakeholders that are really on this journey from the beginning, and they are still here. So today, I just want to say that this exceeded my expectation, and this also exceeded our expectations as SAPRA. So most importantly, the stakeholder NEPs. The stakeholder NEP, the people that you see in this room, I'm not seeing them for the first time, or it's not the second time. These are the people who developed this. So WHO, if you think maybe this is just a face, no. This collective is the one that put this together. So we took this serious, and we worked since you met with our executives, and we therefore, as a collective, the people who are in here, and of course there are some that that are not here, but we have collectively come up with this document, and we are saying that we are committed to taking it further. So NEP committee, big up to you. The technical working groups, big up to you. And when I say SAPRA, I mean the whole SAPRA as an organization, and then in particular, the regulatory compliance team, big up to you for all your efforts to making sure that our stakeholders remain focused in ensuring that this journey is achieved. I don't know if you imagined this day like this. You didn't, ne? Yeah, so I really want, I don't even know how to express this, but we are really, really grateful to our leaders, to South Africa. We have a great country. If our country can put this together, you can imagine, yes, we put it in paper, but the commitment that we were getting, we know that we are going to go beyond this together. That commitment, I believe. So what we are just asking for is a delegation of authority that the NEP committees have more power to take decisions. That's what we need in order to make sure that this will be sustainable. We will be able in 5 years to come back and say we are going on stronger and we are leading not only in the continent but globally. And we hope that in 5 years we will be speaking. We are already ML4 in all levels, WHO, and we are also the global leader. So that's what we're hoping. This is where we are striving for. So the commitment is pledged by the role players, and we are very grateful. And this is because today is the launch, so this speaks for itself to show that the colleagues are completely committed. They just need high-level support to ensure that implementation will come to fruition. Thank you very much. And Prof, thank you to you too and your staff for the sleepless nights that we had, the endless meetings. I hope I didn't forget anyone, but I'm thanking everyone, and CEO, CRO, and SAPRA staff. Let's keep up the good work. Thank you.
Thank you very much. All right, we've come now to the last session. Right, there's a long list of people who would like to give messages of support, but if the person has already left, obviously we'll leave them out. And if you don't feel you need to do it, it's also okay. Can I ask the team there to switch on the clock here? Please, I want to see it must say 2 minutes. Right, the first, you please come one after the other, okay, so that we save time. Anyone from Gauteng Department of Health? I know the MEC has spoken. You can always do a career limiting move and speak after the MEC. If there's anybody who wants to limit their career, can come from Gauteng Department of Health. All right, nobody, all right. South African Police Service, please. Can go, the microphone is there.
Thank you, Program Director. All protocol observed. I'm Brigadier Mthembu, the Section Head in Organized Crime Investigation, Narcotics. It was a great pleasure for us to be a part of this workshop. MEC, I'm very happy to see you in our midst and other stakeholders. This is a very, very important move, of which I think it won't end today. We have started, but we are going to go somewhere. Even when I've retired, we are still going to continue with the struggles. It does not mean retirement is the end of the struggle. The struggles continues. Aluta continue. Currently, the South African Police Service is waiting an approval from the National Commissioner for Engagement with the SAPRA, according to the discussion of the MOU with the SAPS. But I think it's going to be done as soon as possible. We don't have any choice. The country is dying. This, if we cannot stop it now, is going to knock into our grandchildren. Those kids that we have taken them to have a better life, doctors. And I'm a little bit scared to have such a lot of PhD people amongst me, but I think I've been privileged to be here. I also want to thank our Stephanie to put us into this mist. Really, you are always assisting us together with Mr. Mopai. The SAPRA people is always on our side. On the organized crime, we are doing the investigation unconventionally, so with the guidance of our NPA. There's nothing that we can do to arrest a syndicate without doing the unconventional investigation. with the assistant of the prosecuting guidance investigation. SAPS, DPCI, we are also on board. We are still going to put more pressure to close the tap of these syndicates or the lawless people who are doing this. Because tomorrow, it can kill you, it can knock into your house, unexpectedly so. We, as law enforcement agents, we have a lot of takedowns. Others were on the media space where the SAPRA communication officers were talking about the successes, their collaboration, and the education awareness campaign, as has been stated, is a key to everything. We learn every day. We need to understand, because there's a lot of drugs or chemicals that are emerging that our kids even know that we don't even know. The simple one that we take them as medication, they can put it as something that can make them to be whatever, hallucinating, you name it, to be people that they wanted to be. Let's be careful. Watch out. Let's live in the country that is free of illicit, counterfeit medicine, so that we should have healthy life. If you're not healthy, there's no way that you can do anything. You can have how educated you are, but if you are not healthy, you can't do anything. With those words, I just want to say thank you, Program Director.
Thank you very much. A round of applause, please. South African Revenue Service representative, anyone from SARS?
He has asked if he can please address everybody from this point.
Yeah, that's fine.
Thank you, Prof. JJ, and all protocol observed. Our commissioner couldn't make it due to other commitment. He's out of the country, but we are here representing SARS. As SARS, we express our unwavering support for the launch of the National Action Plan. We have been part of the steering committee and also making sure that as part of the collaborative multi-stakeholder approach, we participate in all the engagement leading today. Today's discussions requires all of us to fulfill our roles and responsibilities with the agency and commitment that this challenge that we're sitting with demands. And collectively, may we together implement this plan rigorously and ensure its sustainability. Thank you.
Thank you very much from the South African Revenue Service. Thank you so much. National Prosecuting Authority of South Africa. Anyone from the NPA? Please, Buntle, please take the mic there.
Lots of mics. I'm from the National Prosecuting Authority, Advocate Entia Panderbeil. I'm with my colleague I'm working in an organized crime unit, and she's working in a commercial crime space. So we are ready to collaborate with SEPRA. In fact, we've been working with you for some time already. And in that regard, we are also, there's already a draft memorandum of understanding that where we will collaborate with the South African Police Service together with SAPRA on continued engagements, and also obviously in the fight of crime. So we are ready to support you, SAPRA, to combat organized crime, also the commercial crime part of it. We will provide you with prosecutorial support. We already have a number of court cases in that regard regarding falsified and substandard medication, counterfeit goods on the court road. We also had a number of project-driven investigations. I can think of 3 in the past, in the recent years, where as the South African Police Service already spoke about the fact that people sometimes use substances, other substances, some of them are listed in the Medicines Control and Related Substances Act, and also in the Drugs and Drug Trafficking Act, to make other illicit drugs, to manufacture illicit drugs. Like now, I'm thinking of the projects that we had. The one that we're all familiar with is cannabis. And in that regard, we actually work with SAPRA. And in another project, it was steroids, and also I mentioned Nyaupe. So we spoke about the training. So we will also need to not only, it should be joint training where we can all understand. From the prosecutorial aspect, we really need to understand the various type of medicines and the composition of these medicines. But we also need to, in conjunction with SARS, with the police, the DPCI Hawks, we all need training, joint training, so that we can embark on more operations and undercover operations, even in that regard, in order to uncover syndicates who participate in this, not only manufacturing, but also smuggling medicines into the country. Thank you. From our side, then, we will also work on public awareness and deterrence together with you. And in that regard, we hope to highlight successful prosecutions to deter future offenders. And we want to actually bring the message that this is a serious crime. It is not just regulatory offenses. And we know that the sentences provided for in the Drugs and Drug Trafficking Act, it can go up to 25 years, but in the Medicines Control Act, it provides for 10 years. And we want to send, in that regard, we will also have, we all know that we have to review legislation. And we will do that in collaboration with all our stakeholders. Thank you.
Thank you very, very much. A representative of the Department of Trade, Industry and Competition.
Can you please raise your hand? I don't think there's any representative
Okay,
from there.
Border Management Authority, please. Just behind you, Buntle.
Thank you, Program Director. All protocol observed. Good afternoon to everybody in the room. I'd like to convey a message from the Border Management Authority. We are definitely in support as a new entity that's in the forefront of border law enforcement functions at ports of entry, working together with other stakeholders such as your SAPRA and your SAPS. We are saying that we have been there in this journey. We will continue. We acknowledge that there are inadequacies that we need to be working together on in terms of our capacity, technology, equipment that would assist us in ensuring that the border law enforcement functions are actually executed to reach even those ports where we are not having enough foot soldiers, both from the SAPRA and the port health discipline. But working together with our other stakeholders will definitely be able to reach the strides that we have put in that very beautiful document that you held. We are excited to form part of the core role players in this critical initiative. And also we are saying, together with all stakeholders, it gives us an authority, as an authority, courage to join hands together with the diversified, multi-skilled and multifaceted team that we are having here in our midst. When we started this morning, Program Director, you gracefully made mention of the fact that as government, we are known to develop plans that are often just beautiful pieces of policy documents that are not actioned. I want to agree with our CEO, Dr. Simete Mokokotelo, who said that we as the BMA and SAPRA are definitely not amongst that list. We are the ones that are doing all that we are able to do to actually action. The reason why I'm saying that, as of yesterday, I was signing through a report that we have received on training that has been done in the Northern Cape. 2 of our ports were trained, and those includes officials from the BMA, officials from the SAPS, as well as other law enforcement agencies, where we were being trained by SAPRA on matters to the legal prescripts that we need to consider. So already we are actioning some of the recommendations that have been made. There was mention of the revision of the Medicines Act. We are very happy to hear that, and we will definitely be participating together with our other instruments that we have successfully finalized and formalized in the last couple of weeks. I believe there will be more news that will be coming pertaining to that. We are excited, and indeed, we see those as strides that we will be working in actioning as we action the NAP that we have committed to. With those words, Program Director and delegates, I want to say thank you for the opportunity to have worked on this very important document, and we look forward and are excited to work together and continue in execution and implementation. We have heard that the majority of the teams that have spoken today have definitely made mention of our responsibility and our mandate when it comes to our ports of entries, our borders, and we are taking those messages very seriously. Thank you very much.
Thank you, thank you. Okay, let's hear from the Department of Social Development, please. Anybody from the Department of Social Development? Okay, Department of Agriculture.
Okay.
Anyone?
Yes.
All right.
Good afternoon, everyone. Thank you, Program Director. As Department of Agriculture, we are ready to support you. We are waiting for SAPRA to give us the dates for raids. We are waiting for SAPRA to give us the date to go on the ground and operate. That's what we do in the Department of Agriculture. We believe in action. Thank you very much.
Thank you. Yeah, that's action. CEO, you heard? They are ready to raid. The Department of Agriculture is ready to raid. They are waiting for a date. We'll also bring the media. Although Dr. Stavros said he doesn't like Hollywood, there must be Hollywood on this one. Department of Health, okay, no, Department of, sorry, not the Department, but the Health Professions Council of South Africa, please. And South African Pharmacy Council. Anybody from those 2 organizations?
Nobody has their hand up?
All right. Okay, I think they've already left.
Yeah.
So they were here, they were on the panel actually. South African National AIDS Council.
Okay.
And Treatment Action Campaign.
Thank you very much, and good afternoon, colleagues. And just to make a correction, is the South African National AIDS Council. The Treatment Action Campaign is part of our civil society forum. Otherwise, they are going to beat me to say, how did you represent us?
You speak on your behalf, yeah, understand.
Yes.
And they are radical.
Yes, so I want to say thank you very much for inviting us to this meeting. We have been looking forward, to having this fruitful discussion. And just to indicate that SANAG, as a coordinating body for the HIV, TB, and STI response in the country, we've got the 3 spheres that are part of our stakeholders, which is the civil society, government, and the private sector. So these position us, as a strategic partner for this work that we're discussing in this meeting. We have been embarking at the community level, reaching out, increasing our testing and bringing those, who have left the treatment to come back. And most of the things that we see when we go on the ground, that's where we realize that there is indeed a need for treatment literacy. And this treatment literacy also encompasses the medicines that we are talking about at this forum. Because, we know that most of our clients, some of them, they've got chronic diseases or they've got other diseases. So the urge to get hold of anything that everybody promises on the ground, it is very high. So hence we are saying that no, we are a strategic partner when it comes, to advocating really for prevention related activities and also for treatment and also for bringing awareness at the community level. Hence we say we are ready, we are a partner. And one of the key things that we really want it to be brought in and come up straight is the role of the manufacturers, of the drugs. That we talk about prevention, but we will really want to see them raising up their hands and saying, how do we assist, in fighting and ensuring that their brands that we are saying that as the communities that we'll be working with, they are also protected, because we'll not necessarily only be saving our people, but we'll also be ensuring that when we speak about that Panado, that is an ordinary drug, that indeed we are also protecting your market. So please also assist us. We need funding. We have heard about a lot of funding cuts that has been happening, and we are saying that no, our doors are open. Please come and work with us. We've got 18 sectors that are ready, that are working at a community level, that are ready to take this work forward and advocating and bringing awareness at all spheres. Thank you.
Thank you very much. Can we have a Central Drug Authority? Central Drug Authority representative, are you here? Central Drug Authority.
Nobody has a hand up.
All right, I think they left. They were here behind us. I'm not sure what happened. Also, you've got a message, written message from the DTIC. Please give that to us, and we are done. And Dr. Nikolai, I will request you to give us the closing remark to close the conference, to close the dialogue.
The message from the DITC reads, on behalf of the Department of Trade and Industry and Competition, I wish to extend our support to the National Action Plan to address the growing burden of substandard and falsified medical products within our borders. This initiative speaks directly to our shared responsibility and commitment of safeguarding the public, strengthening the integrity of our markets and industrial activity, as well as ensuring that only safe, quality, assured medicines and other medical products reach our patients. Substandard and falsified products not only put lives at risk, but they also undermine trust in the health system and disrupt legitimate industry and trade. It goes without saying that it also undermines national efforts to grow the economy, and specifically an industry already dominated by imports. The DTIC is committed to working closely with our partners to strengthen regulatory systems, improve enforcement, and support innovation, investment, and industry growth. So South Africa continues to build a resilient pharmaceutical and healthcare sector. We commend the leadership of SAPRA and the WHO, as well as supporting entities in spearheading this vital effort, and reaffirm our commitment to collaborate in protecting South Africans from the dangers of substandard and falsified medical products. Together, we can safeguard lives, support industry, and uphold the integrity of our health system. The department, thank you.
Thank you very much. Is there anyone from the PSA, please? PSA, I think it's Public Service Association.
No.
Or not? It's not public service. PSSA, I think there's something else.
Yes.
Oh, okay, sorry. Please introduce yourself. I thought you were a unionist.
Good afternoon. My name is Refilo Mokale. I am from the Pharmaceutical Society of South Africa. I'm here on behalf of our society. We represent close to 14,000 pharmacists in the country, and they are from 4 corners of the world, which community pharmacists, academia, hospital, and manufacturing. We want to extend our heartfelt support for the launch of NAP and to Daphne for including us in this program. As Dr. Stavros said earlier, pharmacists stand at the front line of safeguarding medicine quality, safety, and trust. The rise of falsified medical products threatens not only the health and the well-being of our communities, but also undermines the integrity of our healthcare system. This NAP represents a decisive step toward a coordinated vigilance, accountability, and patient protection. We therefore commend the collaborative leadership that has brought this plan to life and affirm our commitment as pharmacists to educate and empower patients who recognize and avoid falsified medicines, strengthen supply chain integrity, and uphold professional standards. Partner with all the stakeholders to ensure access to safe and genuine medical products for all. So this launch for us signals a renewed pledge to protect lives and preserve trust in healthcare. As pharmacists, we are proud to contribute our expertise and advocacy towards successful implementation of this plan so that every patient in our country can access medicines that are safe, effective, and assured quality. Thank you.
Thank you very much. Dr. Stavros, please close for us.
I'm pleased I didn't have to do a message of support, because I would have echoed everything and anything everyone else said. So, Professor Tabane, you said you live your life vicariously through other medical colleagues, and you didn't disclose your sister is a top medical oncologist in this country. There was no disclosure on that. So I think your sister will be very proud of what you did today, because I think this has been an incredibly important conversation, a launch of a national action plan. I think it's allowed us to crystallize the extent and magnitude of the problem. Many people have called it a societal scourge, and that's exactly what it is. And we daren't live with societal scourges any longer. So my closing remarks are really twofold. I think the first is to commend and congratulate again the National Department of Health, represented here by Dr. Anban Pillay. We heard from the Minister, we heard from the MEC, to commend and congratulate the World Health Organization. Unfortunately, the regional directors left. And then also to commend and congratulate Tumi and her team for this initiative. It's a joint and collaborative initiative. And I think a lot of effort went into, in the first instance, preparing the National Action Plan, and then in the second instance, putting a very diverse audience together today, and a very articulate audience, I might add, as well. So that's the kind of the pleasant stuff, Professor Tabane, when we talk about that. Now let me get to the second and final point, which is the work starts today. Okay. And very pleased that there's a steering committee to me. I think it needs to be institutionalized. It needs to be properly resourced and capacitated. And I think you'll find a willing partner in business to try and assist with that. I think various suggestions have come out today. But today's launch is only going to be as good as our ability to implement and execute. There are clearly a number of challenges. You're dealing with very sophisticated syndicates. And I think what's going to be really important is that we all work together cohesively and collaboratively to succeed and to successfully and effectively execute on this initiative. It is an ambitious initiative, but it is one very worthwhile doing, because as our colleague from BMA said, and another colleague from SAPS, we daren't stand here and know that under our watch, children died, people on chronic medication worsened, and we drove the mortality and morbidity up in the country, and it had an economic impact. So we daren't under our watch allow that to happen, and what I saw was great commitment from everyone today, and we look forward to all working together to eliminate the scourge of falsified and substandard medicines from society. So thanks very much, everyone. And I believe lunch is served. Am I right?
All right. Let us all stand. Buntle, can you please announce the lunch arrangement quickly?
Okay, so when everybody walks out, you pass the lovely ladies in front. You are going to collect your boarding pass, it's called, and that will basically give you access to the lunch area.
Right, lunch is in the dining hall, I think. Yeah?
Yes, it's called
In the
the Warehouse Restaurant.
All right. Let us stand for the national anthem. As we close, thank you very much for participating. Say to the person next to you, thank you for showing up. Now it's time for action. National anthem, please.
There's a place in your heart, and I know that it is love. And this place could be much brighter than tomorrow. And if you really try, you find there's no need to cry. In this place, you feel there's no hurt or sorrow. There are ways to get there if you care enough for living. Make a better place for you and for me.
Meine Damen und Herren, der Soweto Gospel Choir.